I'm your host for today's event. I just want to announce very quickly that we start 5 minutes later, as it's Saturday and everyone needs some time. We are ready, but we'll wait for 5 minutes. See you. Okay, shall we make a start? Well, welcome everybody to the second day of Between Countries Perspectives on the Mental Health of Syrian Refugees in Germany and Turkey, an event organized by the Turkish Red Crescent and the German Red Cross. And we can start actually with something that we did yesterday as well with a Mentimeter. So let's see, you can find the link in the chat, click on it and fill it out. What are you looking forward to today? And then we'll shortly see what you are looking forward to. Well, so far, not that much, it seems. But I can say that, I'm looking forward most to interesting discussions and really, really great personal stories that I'm really looking forward to hear. Meeting colleagues, exchange, inspiration, female perspectives. That's an important point. There's one breakout session on that later on. A lot of stuff. Thank you. Let's keep that in mind. Information, also a good point. Insights and dialogue, not to forget. Hope is also something that I hope we will take out of this at the end of the day as well. Let's move on then. But first of all, I would like to thank you again for coming here, and even on a Saturday. That's really appreciated, and it's great to see how many of you actually are there. Thank you. Let's get ahead with a few technicalities. Actually, most of you will know them from yesterday, but I just repeat them very quickly. So one thing is, of course, you will be muted from as a standard, but you can be unmuted by the hosts if you want to say something in a Q&A, for example. Co-hosts can unmute themselves. That's just a little note. And if you ask questions, I would like to ask you to have your video on. You can ask questions in the chat. That's kind of the standard procedure here with us. But you can also, if you prefer to ask a question in person with your video on and unmuted, you can indicate that with a little star in the chat so we know, and then you can go and forward. And for the interpretation, so the conference language is English, but of course we'll hear multiple other languages as well. So if you want interpretation, just choose the English channel and you have it. Because we have a couple of panelists today who will speak in Arabic, but then also later on in German and in Turkish. I'm just seeing this question with the videos. As long as you're not asking a question in person, it's not really important. Whatever feels best for you, that's ideal. Well, then, I would like to continue with a short introduction of myself. I'm Leo Wigger. I'm an editor at Zenit magazine, one of Germany's leading news and media platforms on the extended Middle East. And I'm also a fellow at the Candid Foundation. So I'm really looking forward to host you for the second day of the event. And let's have a quick look maybe at today. So we will, today we'll look at perspectives beyond therapy, hurdles, connectors, and community support. Start with a couple of minutes of recap from yesterday, and then, join in this first joint session on the living situation of Syrian refugees in Germany and Turkey. We'll have three panelists with us there who will share their stories of settling in and living in Germany and Turkey. And then we will have, most of you will know that from yesterday, we'll have breakout sessions. And then, for one hour, a break before, a break afterwards, and then conclude with the last joint session, which will kind of try to bring together all the things that we've discussed over these 2.5 days. Reflect on the breakout sessions, and have a panel discussion on the impactful connectors, basically. And then that's it for today and for this conference. So let me continue with a little summary of the main points from yesterday. I think, I would really invite you to comment on that as well, or if you want to share some of your insights or what you took from yesterday. I really want to welcome you to do that just after my brief introduction, because I think it's important to hear as many perspectives as possible. But what I took from yesterday was that, the mental, the basic needs and protection, the basic needs and the protection of individuals is key, is kind of crucial in order to create the space that is necessary for mental health support. And only when these basic requirements are being met can treatment become meaningful. Then another takeaway was that interpersonal and environmental dynamics continuously impact the mental health situation of the individuals affected. And it's impossible to tune that out. And that brings us to another key aspect from yesterday, which is trust, and trust in a variety of meanings. First of all, trust is crucial for a meaningful therapeutic setting, but boundaries, gender aspects, and of course, overcoming stigma are components that are really important in creating a trusting relationship between clients and interpreters. We talked about that in one of the sessions yesterday. Therapists, of course, social workers, or any other trusted contact that clients might turn to. But of course, trust also entails finding a balance between closeness and distance, which is also very, very important. For therapists, for interpreters, and for any other providers of support. And that is also, and we touched upon that yesterday as well, in order to react to early signs of secondary traumatization, another important issue, and of course, burnout as well. And the last point that I'm taking and that I took from yesterday is that, of course, a feeling of agency is crucial for people affected to ensure that they perceive of themselves as the agents of their own story, and that it's not others who define who they are. So yeah, this event is really, really also about that, giving individuals the room to share their stories. So if you want to share your main takeaways from yesterday, I would really like to invite you to do that now. Are there any? Well, if not, I would, take last little break here for the next 10 minutes, so you can all settle and prepare for the first panel discussion, which will where we will meet three Syrians who are coming, who have migrated to Turkey and to Germany, and will share their stories. But yeah, see you then at 10 German time, 11 Turkish time here, and yeah, looking forward.
Hallo?
Hello, Razan.
Hallo.
You're live. Well, then, welcome everybody to our first panel session of today, which is on the living situation of Syrian refugees in Germany and in Turkey. The two countries host the two largest Syrian refugee populations, respectively. I mean, the one in Turkey is actually much larger than in Germany. That's something that I think many people in Germany are not always aware of. That, it's almost 5 times as large as in Germany. But yeah, we will look into that today and hear the stories of Razan, Ahmed, and Abdullah, 2 from Germany, 1 from Turkey. So Razan, let's start with you. Can you introduce yourself and tell us a little bit about your story and just technical detail? Yeah, we will continue with Ahmed afterwards and then with Abdullah. And then we have some time for a Q&A where we can, continue some of the aspects that you raised and dig a little deeper into your stories. Razan, please go ahead.
شكرا. أنا رزان عفيفي. أنا جهزت.
Thank you very much. I'm Razan Afifi. I actually had prepared some notes in advance, and I would like to read them aloud in order for you to better follow up and ask me concrete questions. Razan Afifi. Hi, everyone. I greet you. At the very beginning, I want to thank you for inviting me here and for allowing me to be part of your very purposeful conference. At the outset, I would like to talk about a girl who came to Germany in the year 2005 to receive medication. This girl was in dire need of what science has reached over here in order to stand on her legs. But her journey of medication was a very harsh one. It took way longer than expected and then allowed for her to stay over here. The laws have neglected and overseen her need to stay here. So she was deprived of her right to apply for asylum. She had a really hard start, going through a lot of phases, starting with the look for medication, education, work, and she was transformed from someone who was in need of help and medication to someone who started providing assistance to others, especially after the waves of refugees who came to Germany starting 2015 and afterward. This little girl is me, Razan Afifi, Palestinian, Syrian, and now partly German. Born 1980 in Damascus. My journey with learning the German language, requiring language skills, started at the Institute of Ishraq in Hala, where I lived. It is a center specialized in educating Oriental languages, including Arabic. The students over there were my common denominator between me and the German population, were the common link. And from there, I started to get introduced to this community, which was crowned by my marriage with a German guy named Marwan. We gave birth to 2 children, first Mustafa and then Milad. When I gave my elder child this name, there has only been a few Arabs or few people of Arab origin here in Germany, but this has changed very quickly. So it got very common to me. I got used to being asked question, why did you give your son the name of Mustafa? Don't you fear that he would suffer afterwards, that he would be discriminated again? I asked back, why should he suffer? He is a German boy, born in Germany, living in Germany, and getting raised here. But my answers were not really convincing. And I started to realize that, just the name can become a burden to his bearer. At least sometimes. I remember once that we were looking for a new home to move in, my husband and I. And the owner of this home called me straight away after having read my name and told me that he doesn't want to rent his apartment, his property to foreigners because he had bad experience in Berlin. And I answered, all right, and I don't want to rent an apartment from someone who is a discriminator. So how are we to change something fundamental between property owners, in the relationship between property owners and people who seek the rent? This is not an individual problem. I realized afterwards, in many occasions, after volunteering to provide assistance and help to newcomers who looked for a place to live in, that this is not the only obstacle they face. From the very beginning, from this phase of asking asylum, after coming to Germany straight away, they are challenged by a huge amount of papers and documentation that requires their signature with instructions that are written in Germany and that are very complicated and very hard to understand for someone who doesn't speak German. There comes a question to my mind, actually. Why don't we work on providing translated versions of these documents and papers, translated into a number of languages as required, into Arabic, into Turkish, etc.? The atmosphere is full of bureaucratic routine, and the German population is the first population to suffer from that routine, even more than newcomers. Then we go to the job center and to other places where I really perceived more than one time to which extent migrants are being treated with without any respect, only on the ground of being foreigners, on the ground of being non-Germans. And I perceived a huge difference whenever my German husband was at my side, was by my side. The very same officer was all of a sudden someone else. So I learned more and more, and I realized that, of course, everything is not to be divided into black and white, that there are a lot of shades of gray, and that we cannot really say or claim that life over here is only black. But nevertheless, asylum seekers bear within their cheeks and within their breasts a huge amount of anxiety. Why? Maybe because they come from countries where they are not treated with respect, countries that don't treat their own population with respect. Maybe because they are afraid of this bottom-down treatment that they receive over here. In only few exceptional cases, people find it easy to live here. I, of course, don't want to compare living in Syria with living in Germany, because we, at the end of the day, came here to look for safety and to look for a new perspective to live in. And we may not forget what we have been through in the inside of Syria. But in our countries, citizenship was nothing we were familiar with. It is really new to us to be granted the right of citizenship over here. But at the very same time, we get the feeling, get the impression that we are a second-class citizen with less privileges and maybe the same amount of rights. So the life of an asylum seeker is either hard or harder, actually. I am reading aloud. I hope you can follow, though. So excuse my reading skills. In any case, those who hold certificates from university are sometimes challenged by the need of reorientation on the job market over here, or enrolling again at university in order to have a job perspective, career perspective. So in any case, I would like to highlight that asylum seekers need to receive assistance and support in a wide array of perspectives, socially, politically, legally, in terms of education, in order to close the gap between newcomers and the German population. Organizations working with refugees can not only aim at securing their income and secure them a place to living and provide them food security. No, because sometimes they receive the income on behalf of those and benefit from them. So I suggest to have government-led programs that practice some oversight that control organizations working with refugees. I don't want to touch upon only financial advantages for refugees. No, we need to secure moral advantages, legal advantages, etc. The elections we had here in Germany a few days ago have came up with results that showed that Sachsen and Sachsen-Anhalt managed to provide a high number of votes to the far right, actually. So it is only logical that migrants prefer to move away from Eastern Germany to the West. And this is something very worrying. Do they do so because they perceive some kind of emptiness, or are they put to such an extent under pressure, to an extent that makes them leave the place of which they thought would become their safe haven? We need to have mechanisms of oversight that provide logical support, that provide neutral support, in order to alleviate their situation and in order to make life better for everyone who lives here in Germany, in order to provide results that stand upon accepting cultural differences. And this is something I realized in the course of my work at different organizations. Mental problems asylum seekers might face do not receive the necessary attention from German institutions. They were teared away from their homeland, and this leaves very deep scars within them. And we have a lot of cases I experienced myself that might be crystal clear to even normal people, non-professionals. Anxiety disorders, depression, isolation, social isolation, introvertism. And I don't really mean to say that each and every asylum seeker suffers from mental problems, but if someone suffers such pain, this pain only leaves scars, cannot but only leave scars. I lived through and experienced a high number of cases with women, for example, who failed to find work here, who were sexually abused from their partners or have experienced violence in their relationships. And now I came up with my own project, actually, dedicated to children with special needs, irrespective of their nationality, of their background. And I started with the first steps towards implementation of this project. I opened a gallery, a arts center in Halle, where I live, and I look to share this place, open the doors of this place to children in order to provide them a safe haven through arts. I want to reckon that Germany has a lot of beautiful faces, a lot of beautiful sights, but there still are these challenges, these hurdles that stand in the way of people who seek a free and safe and secure and stable life. There is this quotation I want to tell you here. You cannot ask me a question, but give me answers. Thank you very much, Razan Afifi.
Razan,
sorry,
so
I
much.
need to listen to the interpretation. I don't hear you. Thank you too.
Well, then let's continue now with a perspective from Turkey with Ahmed. Ahmed, can you hear us?
Yeah. Okay.
Is your camera on? Can you turn it on? Ah, perfect. Thank you.
Yeah, thank you very much. I will see.
First of all, I would like to say that I am Ahmed Soom. I'm a Syrian refugee. Sorry, the sound is jammed.
Well, I think Ahmed, we need to. Yeah, your connection is not strong enough. So let's move to Abdullah now and come back to you. And if it's not better, then we'll try without the video. But Abdullah, then let's continue with you. Abdullah.
Hello, marhaba.
Hello. I'm Abdullah Saji, and I live in Germany. Have been living here for 6 years in Germany, in Hanover. I am currently, and I am a student here, and I especially in the field of media. And I would like to say that I am very grateful to Ms. Afifa that they was so frankly speaking about reality. And of course, we see that we have many young people and refugees here who experience the same stories. And I can say that I have also come across this. That means especially that here in Hanover, I have been here now for 1 month, and I'm here as a student. I'm in a VG with other students, and I have in my room pictures of Jesus, and I'm personally, I do not, I'm not very religious, but I have no problems with religions, but of course I have some mental problems as well, and I remember that somebody came in and told me this is exerts mental pressure, such pictures. I don't like them. Please take them off. But I said, no, why shouldn't we leave them here? And the owner of the flat insisted in taking it off. And so I got quite angry about this. And I reminded him of the German culture, which is open. And so I said this position is not natural, it's not normal. This had a great impact on me. Of course, there are other things, other problems. First, at the beginning, learning the language and so on. And also the lack of money, but this is now better. But unfortunately, we are living now in the year 2021, and so the situation has been improved, and so that's I'm very grateful of.
Thank you, Abdullah. Let's now try if Ahmed's bandwidth is strong enough now. Yeah.
ما بعرف هيك ماشي الحال فبلش احكي ثم يوقف بعدين.
Let us try again. Do you hear me? No, not properly.
I think let's try it without camera, please. Thank you.
بسم الله. أول شيء
The first is that. Oh, sorry.
Still not working.
Crackling and jamming.
Okay. Well, then let's continue with a couple of questions then, and I hope Ahmed, maybe you can move to another room or something to try to increase your bandwidth, and then we can try to get back to you later on. But then sorry, Ahmed. It would be great to hear your story. You could try with microphone or headset as well, but I get the indication here that it's the internet connectivity that is not strong enough. Okay, but we're trying to get him also via phone on here. Okay, then my first question, because I haven't seen any question here, is like, what, and I mean, Razan, you beautifully kind of told your story, like your challenges, but also what gives you hope and how you get support. I would like to kind of look a bit deeper into that. What are you, Abdullah, as well, doing in terms of self-help? What helps you to deal with the situation and the many different hardships that you experience while living in your new home?
هلا أنت بتسمعني؟ هل تسمعني؟
Do you hear me?
Yes.
In my personal opinion, I think that there has been a change in the infrastructure. But I think there should be more of that. If politicians would do more in the way that they asylum seekers can really integrate themselves, not only giving them money or material support. So, for example, the translation of all the papers and of all the paperwork and so in their languages, this would help a lot. And when I came here and I wanted treatment for the children, it was very difficult. Even in English, it was difficult to interact with the specialist people there. So it is difficult for you if you don't find anybody who understands you. And of course, some people are also hesitant, but especially I see also some kind of racism when there is a woman with a headscarf or so, and I also have people seen who have spit on the or they touching you, or then you are, and they tell you think what I don't know what they mean, and so I think that the organizations here in Halle, I expect that they make it easier for us. Sometimes when I have to do something in one of the authorities, there are 100 people or more. So especially also mental support for the refugees, there could be more. Is really a high number who need this and who need support and assistance. Have you understood what I mean, or do you have more questions?
No, I thought that was yeah, great. But yeah, I was also trying to find out a bit more about what works best for you personally, to get strength in during difficult or challenging time. But maybe Abdullah, we'll go to you first, and then we come back to Razan. Abdullah, what in terms of self-help, what helps you? What has worked for you while since coming to Germany?
ما اعتقد ما فهمت السؤال. ممكن تعيده؟
I don't understand.
Well, I mean, like what are practices or routines or things to kind of support yourself, build, like a support system for yourself to deal with difficult situations?
نعم للأسف كنت أضطر.
Yes, unfortunately, I was compelled to stay at home first to learn the language. Of course, the language is the key of another country, and you have to be understood here. And this was the prerequisite. And so from the very beginning, I had to learn the language and then to try to interact, to integrate with others, especially by talking to them, and also to try to come to the point. That means that they understand we should respect everybody. I also respect that they respect us, and also to understand the German culture where we have now arrived. And I think the first thing to find out how to deal with people here. That means also to understand what are the aspirations of people, what do they expect from me, and sometimes it was a bit funny when I heard quite violent music. I was sitting to recover, also mentally to recover. I was sitting at home. And of course, when you have left Syria, you need some time to think and to recover. But sometimes there's a music which is very stressful. What I would like to tell, what Abdullah wanted to say also, this is to respect others, to respect each other. So, of course, language is difficult, but this is easier than learning to respect each other, to understand each other also. Nobody else has asked me about myself, where I am coming from, what are my problems or my issues. Why do I, for example, choose this cup? But this is my decision, but nobody is interested in these things. Yes, this is what I also have experienced, Razan.
Thanks. Yeah, really like the spirit. Maybe another aspect that we could discuss is, I mean, Razan, you are living in Halle, which is a mid-sized city in eastern Germany, and Abdullah, you are living in a slightly bigger but also mid-sized city in Western Germany. We just had actually last week in Halle the 31st celebration of reunification, which was a big festivity. And that brings us to the question, like, how are regional factors inside of Germany playing in when it comes to your experiences between like east and west, between north and south, between mid-sized city and larger cities, when it comes to access to support networks? Razan, do you want to start?
Yes, I start. This day, we had a guest in our town, Angela Merkel, and she was there in a church, and Angela Merkel here in this context, I have to talk about what happened in Halle, of how many racists are there and extremists are there. Sachsen-Anhalt, of course, we know that last elections the right-wing party has won in Sachsen-Anhalt, and so in Germany, of course, this has drawn the attention of Germans. And in East Germany, there is no integration and there's no respect to others and of others, and so this is a bit special, I would say. This difficult to explain this, especially when you see that there's such a conflict between right-wing and left-wing people. And in Halle especially, the proportion of racists is relatively high. And of course, also, this has its, there's always a pressure, also some open pressure, like when they are shouting "Raus, raus" or something like this. So Halle and the Sachsen-Anhalt, sometimes I think they want to say that the Germans are the best in the world or something like this. And if the headscarf, this is something like no brain, or I don't know, I don't understand. I don't have to add anything to this, and especially concerning these parties, I know this AfD party, it is very strong in the east of Germany. And at the beginning, the first 5 years, I lived in Sachsen-Anhalt, in Magdeburg. And unfortunately, at that time, in fact, and frankly say, life was, I didn't like the life there. And it was difficult to live there for 5 years. And some people asked me, how was it possible for you to live there within this racism? Of course, there's really some kind of fleeing out of this area. I have friends, he is a musician, or he was a musician in Halle, and now he's in Hamburg. And I have the feeling that he is a... He said, this is my homeland, but now he has gone. And in Halle, I often see that that there's some kind of gute Laune, and then it changed into the completely different situation. And this happens suddenly. And I was there in Sachsen-Anhalt, and I had 2 jobs within 1 month. And I was working with an organization in Halle Saale, which was also supporting refugees there. And I have then often applied for jobs very often there in Sachsen-Anhalt. Sorry.
Now it seems that Abdullah is frozen.
Don't hear him.
Well,
then I
Razan,
did the vocational training.
Okay. So are you, no, I think Abdullah's connection is still with 2 weeks. So Razan, maybe just continue. We come back to Abdullah later on.
يعني أنا ما بدي أكون سوداوية.
I do not want to be too bleak concerning Halle, but in 2016 I made a drama which was anxiety is not a sickness, and we did this drama. We showed it in the biggest theaters here with refugees, with foreigners, and I think every time there were between 400, 450 people in the audience, and this was quite successful. So I also would like to talk about the success. That means when and one can find also a development when we compare 2016 to 2021. In the beginning, of course, I couldn't understand the language, and it is so that people have learned a lot, have worked a lot. We had problems, we had difficulties, but there's a very big development now. And when you now knock at the door there and you say you need this or that, of course there is still pressure, but people are more open-minded, and Syrians, Iranians, Afghans, and so on, they have already also achieved some success in many fields. So with this society, and there is also some kind of integration, and my work has, of course, helped me in integrating it. Especially by art, whether in the theater or now in other kinds of arts.
Razan, thank you. So yeah, I'm taking, like, just to summarize, I'm taking here from this that there are or that both of you have experienced a certain set of regional disparities when it comes to access and also attitudes of people in Germany towards you, and yeah, a difference between larger cities, of course, and smaller cities and the rural areas, and yeah. Okay, then we have one question from the audience that I would like to ask now. And then I think for the last 10 minutes, ideally, we can go back to Ahmed. But yeah, the question is, how are services for refugees made public in your towns? And do people know what kind of services are offered? What kind of facilities would you need? And how would you like to be informed about them? So that is like the second part of the question, which is, of course, more connected to what you would need, and what would work for you as a good practice. yeah, the question was asked by Katarina. Abdullah, do you want to go first?
أعتقد رزان.
I think I'd prefer for Razan to begin.
Okay, sure. Razan.
يعني هي سألت يعني
So, what kind of services are offered? How are they made public? The problem is that we do receive services, that we have access to services, but they need to be much more spread over the media, because we have cultural programs, for example. They are there, but media still needs to play a better role, a bigger role, and to promote them. This promotion, as the aspect of promotion is missing, in the sense that positive information is also being spread. And instead of that, the media agencies and media channels prefer to spread scandals and other kinds of information, let's say. Abdullah, for example, or others who got started, who opened up their centers and played a role in order to spread the Arab culture, and try to maybe make a better use of media or media channels in that sense, social media especially. Thank you very much, but I still don't think I've answered the second question. Maybe you can remind me of the second question.
Abdullah, are you ready? So yeah, it's about how, I mean, just like in theory, basically, like ideally, how would you like to find, what would work for you if you think about like how to access information on how? Abdullah? Yeah, so the question is basically about like, if you think ideally, how could support be, kind of, what would really help you is the first thing. And the second thing is like, how would you like to find out about that, that this exists? Because I think what's like kind of indicated there as well is that there are a certain set of help or support networks available in or offerings in Germany that a lot of people are often not aware of, and which offerings would work for you and what would work for you in terms of like how that you would actually find out about them, that they exist. But Razan, maybe you want to go first.
يعني كما قلت إذا نحن
Well, as I said, if we provide for translated paperwork, that would be of a great help, irrespective of the kind of institution. Even if I have a flyer in my hand, if I hold a flyer and I read it in my own language, in my mother tongue, that would attract my attention even more, and I would inhale way more knowledge and way more information, and I would take more with me. So maybe more translation work is required. Mais, for example, a friend of mine, she works at an organization named Salam, Peace, and they offer a lot wonderful offerings, important offerings, even to those who are in need of mental support, psychological support, integration into Germany, etc. But she only spreads the word via phone. She doesn't even issue flyers. That would be the simplest thing, to have some flyers at a stand or in a booth or at a board at universities, for example, or refugee camps or whatsoever, in order to spread the word in a more effective way. So more brochures, more flyers, and just to get closer to the migrant population, through translation and through their own mother tongue. Yes, this is something I second, and I would like to add something as well. I personally, we are a media company that makes videos for TV, and unfortunately, what we work on is rather what I can describe as a scandal. For example, someone killed someone, there is a murder, or there is a bad story, there is something controversial to put the spotlight on. But if there's a success story, you won't hear a word about it. And this is something we really miss in the German media and on German TV. Success stories among Syrian refugees, because we get to know them, we get to hear of them through Facebook groups, etc., WhatsApp groups, but not through the German media, not through the German TV. Success stories of Syrians, we rarely really hear of them via German channels. Yes, but this is something you would find in each and every culture, everywhere actually. Bad news are easier to disseminate and are easier to spread. And the purpose is not really to support refugees behind media work. This is a completely different topic. But I speak of Halle and I speak of Eastern Germany because I've never lived there. I just heard of friends that life there is way better. When I came here, I was really compelled to extend my residence permit. So that was something very important for me to receive the surgery to get my knees operated. And this is something that was totally neglected. They didn't pay any attention to this fact, to the fact that I need treatment, I need medication. It is an exceptional situation. But they told me at the Ausländerbehörde, you have your resident permit. When your time is up, your time is up. You need to go back home. So I needed to go to a local newspaper to make pictures of myself, make pictures of my knee, and in order to make my voice heard on my own way, in order to say, I cannot get back to Syria this way. Even if you put laws above the individual, this can't happen. You can ease the ties of law a bit, because of course the law would say that I would have to get back home, but I need treatment, and this is something very hard for me to face as a Syrian or as a Palestinian who needs to get back to Syria and who needed a huge amount of time in order to come to Germany at first. And now, of course, my situation has changed. I am an artist. I have my visual artist studio or atelier. I was compelled to go the hard way, to take things the hard way. So this is a comparison between 2005 and now. But you see, it left some scars behind.
Thank you so much. I think we're still trying to find a way to connect with Ahmed in Turkey. But so far, unfortunately, we haven't found a way. But so, yeah, we have to focus on the German perspective for a bit more. I think another aspect that I would like to hear your opinion about is the Syrian community. I mean, we talked about that a little bit yesterday as well. To what extent is the Syrian community unified? Can you speak of one community, and is that something that where a lot of offerings for help can be found? Razan.
يعني لا يوجد جالية سورية هنا.
Of course, I don't know if we can speak of a Syrian community here, a unified Syrian community. This is something that you would not find. I think it's something we need to delve more into. It's as a Syrian or as Palestinians, we are individuals who get introduced to themselves over here. Some people from Hasaka, some people else from elsewhere, we are completely different. We are totally different. Despite the fact that we share the same nationality, we have completely different identities. That's why we still need to get introduced to each other, learn more about each other in order to speak about a common identity. Yes, actually, of course, you experience racism, discrimination over here. So you cannot even speak about or use the term Syrian community, because even Syrians among each other, they mock each other because of the dialects, for example. They laugh at the dialects of the others. So it is a controversial issue.
Thanks for sharing this. Another aspect is, or like to take it, maybe end this on a more positive note and a more optimistic note. I mean, if you think about a younger version of yourself, what would you like to tell them, or generally newcomers into your situation? What would be helpful and has worked for you very well in coming and in adapting to a new life? What would you have? Yeah, what have you got out of this? It's a difficult question, so maybe I give you a couple of seconds to sort. But Razan, do you want to start?
هو سؤال
Yes, it is a very deep question. It is a very lovely question, though. And it is a question that comes to my mind, actually. I am 41 now, and when I came here to Germany in 2005, I was still 25 years young. So honestly, I was hoping not to reach Germany, not to come to Germany back then. And it surprised me, actually. Me, as an Arab girl, I was looking at Europe as the wage of humanity and humanism, and the roots of humanism, and the place of freedom of living without any restrictions and ties. Of course, you know that the Arab countries and the communities over there impose a lot of restrictions, and especially on women. So you hope to come to Europe and you hope to flee these problems and this pressure you are exposed to as a female, as a woman. Over here, you come and face the fact that you are being declined. So you ask yourself, where should I go? I'd rather then prefer to get back to Syria, to stay at Syria. Of course, things changed because the country became war-torn, and now I'm married, now I got 2 children. But back then, I usually used to look at Razan and what Razan had achieved in Syria, and versus Razan, who is new here in Germany and needs to start at the scale of 0. And it was a very, very difficult choice for me. I was hoping back then to stay in Syria, to get back into Syria. And Syria used to be more beautiful in my eyes. And imagine this against the background that I am a Palestinian. So I actually used to be a refugee in Syria, and I'm now a refugee in Germany. So I have nothing that I can call home or that I can count myself to, you know.
Thank you, Razan. Abdullah, I saw you were following quite intensively. What would you like to add? Would you subscribe to many of the things that Razan said? Although I do think that you are not hailing from the Palestinian community of Syria. You are muted, Abdullah. Now it's
أكيد.
شكرا
رزان.
Thank you, Razan, for raising some beautiful aspects, actually. What I would like to add is that I'm someone who grew in a war-torn country. So I left Syria at the age of 10. I haven't seen, other than that, I've lived in war, and then I left the country. When I reached Turkey, I was 15 years old. I started to work straight away, and it was hard work for someone in my age. Then I left for Germany. And unfortunately, now I long for some things, because here you live as a foreigner, and living as a foreigner and missing your homeland and feeling that you don't belong to this country is something that I'm obsessed of. Sometimes to the extent that I miss the sound of war, you know, of planes, of fight jets. And this is totally crazy, I know, but I miss the past. You realize that you are here someone who is not accepted, who is not welcomed, and you start to become nostalgic about your past. Interpreter's remark, there's a connection interruption.
Yeah, I think, Abdullah, we couldn't hear the last bit, I think. Well, I would like to, Abdullah, do you want to repeat the last sentence? If not, because it was just a poor connection, but if not, it's also fine.
خلاص تمام. أنا ما بدي أضيف شيء.
I don't need to add or repeat. No problem.
Okay.
I think I'll leave it that way.
Well, thank you too so much for sharing all of these personal experiences and insights. That was really quite extraordinary. Thank you too. Unfortunately, we're limited now to the German perspective. But yeah, I hope it was as interesting for you as for me as I mean, I took a lot out of this, but we will get a video from Ahmed from Turkey, and so we'll have a little bit of the Turkish perspective as well. We will now have a little break, and then you have your breakout sessions. So basically the first one is on female perspectives. Then we have the legal situation, also something that we touched upon here. Then we have COVID pandemic, something that we briefly talked about yesterday, and that one will also be streamed on the live stream on YouTube. And then we have one other issue that we talked about briefly as well, which is there such a thing as one Syrian community in Germany and Turkey? I think you all signed up for them, and we will then meet for a last joint session afterwards. There will be a half an hour break in between though. So thank you so much, and looking forward to see you later.
شكرا لك. شكرا.
hey to everyone who's still in this room. We are having the breakout sessions now, and they are in different Zoom rooms. So I think you can find the link to your respective Zoom breakout session room in the chat in a second. Thank you.
I would like to propose, first, let's try to create a safe space for this session to ensure everyone can equally participate in safe environment. We would like all participants and the interpreters to keep sensitive information shared in the session confidential. If there's anything that you would like to share with colleagues relate back to your work, please try not to attribute specific content to any individual to ensure confidentiality. In addition, we would like to also this session to be guided by the principle of non-discrimination and safety, and encourage kindness and respect to each other as we proceed with the discussion. During the presentations of our speakers, you might like to log your questions in the chat box. I will pick up these questions throughout the presentations to ask them, or you could raise your hand later after the sessions. Once we have the discussion, you probably already know there's a panel with reactions in this Zoom application. You can just raise your hand or thumbs up, and that will symbolize that you'd like to speak, and I will turn to you, give you the floor. Without further ado, I would like to introduce our special guests today, Marlene and Rabia. We'll begin from introducing Marlene, so I will just give her background before we get to her presentation. So first, Marlene Leisenheimer. She worked on the migration and integration research at the Political Institute at University of Friedrich Alexander Universität Erlangen, Nuremberg, and she co-authored a study called The Effects and Scenarios of COVID-19 on Migration and Integration, published last April. She also wrote her bachelor's thesis on the integration of migrant women and girls during COVID-19, which will be published on the website soon. She studied theater and media studies and political science at the Friedrich Alexander Universität Erlangen, Nuremberg. Welcome, Marlene, and the floor is yours. Thank you for being with us.
Thank you, Sandra, for the introduction. I'm Marlene Leisenheimer, and I'm happy to be here today. As Sandra just said, I will present the results of a study that I co-authored last year. The COVID-19 pandemic has its effects on all aspects of society, economy, and politics, and people with migration experience and refugees are hit especially hard. Our study, supported by the Stiftung Mercator, examined these effects in the participation areas: health, housing, education, work, as well as the cross-section topic, discrimination and racism. Maybe now would be a good time to share the presentation, Lucas. Thank you. I can't see it yet. I will wait a second. Perfect. We conducted a desk-based study, hence we didn't collect our own data, but instead our research relied mostly on secondary data. Our aim was to find out challenges and problems, as well as ways to address them. The project was on for 6 months, and was conducted by PhD student Yasemin Bekyol, Professor Petra Bendel, and me. Looking at current developments, we then also deducted policy recommendations for each field. I would like to present the main results of our study to you now. Let's go to the next, thank you. Let's start with some general observation on mobility and migration. Border closures that became reality in most countries of the world led to insecurities and to precarious living conditions, especially for stranded migrants and refugees. They suffered from a lack of information, a lack of healthcare, and a higher stigmatization. But those mobility restrictions have affected different groups in different ways. For quite a long time, for example, asylum seekers have not had access to asylum. Resettlement programs, humanitarian admission programs, and family reunifications had been paused, and some are still restricted now. At the same time, restrictions, especially for seasonal migrant workers, have been avoided or lifted quickly. Now to participation. If you could go to the next, thank you. Let's start with the access to health. Existing barriers related to migration, such as little German knowledge or a lack of information about care concepts and structures, have become bigger. They have especially hit vulnerable groups, such as disabled people or people with chronic diseases, as well as women. Already before the pandemic, the access to health for migrants has been criticized in Germany, especially as asylum seekers here only have access to emergency aid, emergency care in the first 18 months of their stay. And this doesn't include, for example, mental health services. Therefore, our policy recommendations are that these barriers need to be addressed and can be lowered, for example, by expanding multilingual accessibility. It has also shown that we need a better access to psychological and psychiatrist health services generally, but especially related to the current crisis. A lot of asylum seekers have experienced different forms of violence and are often traumatized. Lastly, the access to masks and vaccinations, also going forward, should be made easier and more accessible for refugees and migrants. Let's go to the next topic, which is housing. The lockdowns have proved that collective accommodation for refugees as well as for migrant workers is especially inappropriate to minimize infections. There is a lack of toiletries like soap or other toiletries, as well as a lack of information. Social distancing is also not possible in most cases. Additionally, the isolation of such accommodations took away most possibilities of consultation, such as therapy or similar services. As the topic of this event is mental health, I also want to stress that the isolation during the lockdowns has led to feelings of loneliness, especially amongst the migrant community. There have also been positive measures, sorry, that was too quick, thank you. Also been positive measures to protect the residents of such accommodation that almost seemed impossible before. For example, people have been allowed to move out of rooms so that they are not full anymore. There have been new canteens and common rooms, and in some cases, they created resident councils to allow an easier communication. This brings us to the policy recommendations. Wherever possible, housing and collective accommodation should be avoided or minimized. There should be a more transparent complaint management system, and anti-discrimination measures can help in supporting migrants and refugees in their access to the housing market. Now the next, thank you. Our next field is education. Existing inequalities in the education system that have existed before the pandemic have been exacerbated and made more obvious. For a lot of migrants and their children, homeschooling has been hard, as they often didn't have access to Wi-Fi or to laptops, tablets, etc. In addition, volunteers couldn't see migrants in person for quite a long time. Those problems, again, were especially hard for those that live in collective accommodations. Lastly, also, a lot of parents couldn't help their children in school due to a lack of language skills or different education backgrounds. Therefore, to avoid lasting damages for groups that are already disadvantaged in education, the access to digitalization should be made easier, and the commitment of volunteers should be encouraged. Digitalization doesn't only mean financial aid for schools, but also education in that field, as well as the commitment of schools and teachers. And going forward in this, we also need to consider diversity. The next area is work, where the effects of the pandemic have been especially hard. Little language skills, different education levels, as well as the difficult recognition of qualifications have been barriers for a lot of migrants before the pandemic. But still, in the beginning of 2020, a lot more asylum seekers had a job in Germany than was expected. But the pandemic hit employees with migration background especially hard, as they have predominantly worked in very endangered jobs, with uncertain terms of employment, or in jobs that were not suitable for working from home. At the same time, the pandemic has shown that a lot of migrants and refugees are so-called key workers. In Germany, this has also led to some positive measures, such as the extension of contracts and an easier recognition of qualifications, especially in the health sector. On the labour market, therefore, the state needs to make sure that support measures create safer and more equal working conditions. Additionally, the recognition of qualifications as well as post-qualification measures needs to be made easier, and integration measures in this field need to be reconsidered. Last but not least, discrimination and racism. During the pandemic, and especially on social media, discriminating and partly racist discussions directed towards refugees and migrants have increased. Migrants and their children were victims of scapegoating, of hatred, violence, and other forms of exclusion. A report of the German Center for Anti-Discrimination has, for example, shown that in Germany in 2020, the requests for consultation about discrimination on racist grounds have increased by almost 80% compared to 2019. Therefore, as our study has shown, we need proactive action against racism and scapegoating, especially on a national level. Apart from reactive work, we also need preventive anti-racist education, not only at schools and universities, but also at the workplace, like in companies and in housing and health facilities. That's where I'm going to sum up our main results on the next slide. Thanks. We might lose a lot of our integration successes of the last years if we don't react appropriately. We need a commitment on all political levels and in all areas of responsibility, as well as in society. The pandemic has shown that migrants and refugees are not a homogenic group, but individuals with own needs. That's why we need inclusive, communicative, and comprehensive measures. Generally speaking, multilingualism is very important, as well as debates about naturalization or communal suffrage for third country nationals. The pandemic has shown an urgent need for a sensitivity towards diversity, not only in institutions that deal with migration and integration, but also in health facilities or other authorities. That's where I stop my presentation for now. Thank you for listening. I'm looking forward to our discussion.
Thank you very much, Marlene. It has been an excellent presentation, and you have touched upon so many different dimensions, showing the complexity of the effects of COVID-19 on the refugees, and how the situations have been exacerbated on so many different levels. And yet you showed us some way forward recommendations, what needs to happen to improve the situation. Thank you so much, and we will follow up with the discussion. Now, let's hear what's happening in Turkey. So we already know what's happening in Germany. And now our dear speaker, Rabia Olcak, will present. Let me just introduce Rabia. She's a clinical psychologist. She has been working at the Turkish Red Crescent Community Center for the last 4 years in Kahramanmaraş, if I read it correctly. She conducted research on COVID-19 and refugees, focusing first on the understanding of the enablers and barriers in health service access among COVID-19 infected refugees in Turkey, which she presented at London Migration Conference. And second, she focused on understanding the pandemic experiences of refugees in terms of their psychosocial well-being. The title is Perspectives of Refugees Residing in Turkey. She will present today these research results in our session today. She studied clinical psychology at the International University of Sarajevo in Bosnia. Her master thesis topic is about the personality and social variables as factors of depression. Now she's pursuing PhD in clinical psychology at Hasan Koloyoncu University in Turkey. Welcome, Rabia. We are happy to have you. The floor is yours.
Hi, Sandra. I am thanking you for introducing me. And Merlin, it was a great presentation. Congratulations. And can you make it? What? Yeah, as you can see that my topic is going to be large place, but I will do my best. I will briefly explain our findings and what is our results are. So the first one is understanding the enablers and barriers in health service access among COVID-19 infected refugees in Turkey, which is presented at London Migration Conference. And second one is understanding the pandemic experience refugees in terms of their psychosocial well-being perspective of refugees residing in Turkey. Actually, we conducted with the research which divided into two different subjects in one research. So next, please. So it is our content part. First of all, I will start the aim of the study and then continue with introduction part. And we are really care about the observation from the field. We have method parts, findings, and conclusion. Next, please. So the aim of the study is to provide the insight on the experience of COVID-19 infected refugees in accessing health service and understanding the pandemic experience of refugees in terms of their social well-being. So we have 6 areas that we are willing to discover. The first one is a language barrier. We want to know how refugees are affected from the language barrier. So the second and third one is a difficulty to reach health service and difficulty to follow up procedures. We want to make brighten of obstacle of these areas as well. And also there are economical consequences of pandemic. We are willing to know how this issue affects the refugees, and others are limited social interaction due to the pandemic. And according to observation, there is an increased level of anxiety. So we want to discover this area and get the answer for our research. So next, please. Introduction. In Turkey, a total 4 million migrants are living, and COVID-19 pandemic has been resulting unprecedented economic and social consequences across the world, where measures to prevent the disease and health service provision fell short in many countries during the pandemic. Migrants become among the most vulnerable group as they pre-existing adverse living conditions such as crowded households, poor living condition, limited access to service, and economic hardship. So access to health, actual use of personal health service, and everything that facilitate or impedes their use. Access means not only getting the right service, but also getting the right service at the right time to promote improved health outcomes. So COVID-19 pandemic, in addition to registration issue, language barrier, and low health literacy. Now we can go on. And as you can see the circle that I will briefly inform you about the Turkey health service procedure and what is mobility of migrants means, and language barrier reach the health service, economic and social consequences of pandemic. So I will briefly inform you about the procedure of Turkey. Migrants living in Turkey are able to get primary and secondary health service. In addition to primary and secondary health service care service, migrants' health service centers and family doctors offer internal medicine, child doctors, gynecology, oral and dental health, and psychosocial support service. Nevertheless, migrants living in Turkey encounter certain restrictions and barriers in accessing health service. Firstly, application of registration and completed registration process is the major challenge for the migrants. According to rules of Turkey, the health service to be given the Syrian, those who have not completed registration can only benefit from contagious and epidemic prevention service and emergency. What about mobility of migrants is another obstacle to sustaining access to health service. According to the regulation, it is essential that those under temporary protection receive health service in the province they have been registered. So Syrians who are under temporary protection frequently change their place in order to find work. Meanwhile, they lost their access to health service. And more important physical obstacle to increase accessible of vulnerable group is low health literacy as well. If ones move their city for finding a job or something else, they can get service from the private hospital. But if you want to, if he or she wants to take a secondary health service, they can only benefit from this city to private hospital unless they do not have dispatch documents. So they need to move their city that he or she has been registered. This is the huge obstacle because generally they do not have enough money to pay a private hospital cost. So also, the most prominent difficulty is the language barrier. They have a difficulty in describing their physical or mental problem or understanding treatment that doctor prescribed. It is really difficult to explain themselves to doctors. Actually, we have some interpreters in each hospital in Turkey, but I think the number of interpreters is less than it is needs. That's why it's kind of difficult, make difficult situation for refugees. So I already mentioned about economic and social consequences previous slides. Next, please. So we are really care about the observation floor of the fleet, which makes our research stronger. A survey consists of open-end question, 10 qualitative questions, observation of 15 specialists, psychiatry, special clinical psychologists, psychiatric nurse and clinical development specialists, child development specialists. So they also found that language is the huge barrier for reaching health service or describing their moods or symptoms. And they also reported that increase in anxiety, reluctance, sleep disruption, and anger. And the specialists found also there is a conflict between the family members, and family relationship is going to be a hard time during the pandemic. Next. So this is our method part. As I mentioned, that it is the qualitative research that semi-structured interviews were carried out with 17 participants. Data were coded using thematic analysis approach through the CATMA. And interviews are carried out by psychologists who have master degree in clinical psychology through a video communication application with assistance of professional interpreter. So next, please. As you all can see that these are the table of our method parts. We have 17 participants, 8 male and 9 females, and you can see the age interval, and there is the occupation and the number of children. And we stated mostly mention physical symptoms, which are aches, fever, fatigue, loss of taste of smell, and difficulty in breathing. Nationality was 2 Turkmens and 15 Syrian. Next, please. These are the result of enablers and barriers in health service access. You can follow up from the tables that we have 2 teams, which is enablers and barriers. We have several sub-teams as well. I will start with enablers. Good level of knowledge about disease and related symptoms, and having pre-existing chronic disease prompted participants to apply the hospitals. So most participants highlighted that they have no difficulty accessing health service, including having tests, medication, and inpatient care. They also reported that family practitioners made calls to check their health status after diagnosis. Moreover, participants with high awareness of transmission took precautionary measures before applying to hospital, including wearing masks, applying hygiene practice, and self-quarantine. So, fever, we have barriers. I already mentioned about being registered in another huge obstacle for reaching health service access. So another one is the language barrier, and language was not another barrier for some participants, as it was barrier for some participants, and it is caused communication problems with health workers and made it difficult for them to express the related symptoms. And lastly, the sub-teams is limited knowledge about service utilization prevents some participants to apply hospital. So next, please. So we have result of psychosocial effect of pandemic. We have 3 teams and several sub-teams. The first one, psychological impacts, which is this emotional effect and cognitive behavioral effect. The second one, the relational impacts, the family relations with Turkish community and restricted relation interaction. And coping strategies are social support, using religion as a coping strategy, and active coping strategies. So in discussion part, I can deeply explain these sub-teams as well. So next part, please. Conclusion, I will briefly conclude our research. Understanding of refugees' experience is essential in establishing their needs and increasing health service access. These findings suggest that the refugees population needs to be informed about COVID-19 transmission and service usage, and language support should be provided by having interpreters presented at hospital to increase the health service access. And the second one is the understanding the refugees' experience about psychosocial well-being is needed to expand to psychological support on refugees by mental health workers, and became a mediator to improve the tie between nations. And this the research helped us to recognize which coping strategies are mostly used by refugees. So next slide. Thank you for all. Teşekkür ederim and thank you.
Thank you very much, Rabia. You have shared findings of a very important study. I'm really glad that you brought it forward, because it's quite a unique study too, because you looked at those who have been affected by COVID, those who contracted COVID. So well done for that. And thanks for, in limited time, highlighting all the key issues. We learned a lot. Thanks for highlighting, especially, we will give you more time to talk about the psychosocial effects soon. And you're giving us the background to the specific physical and other barriers affecting people's access to health services. Thank you again. And I will open now the floor for everyone to ask questions to our speakers. Are there any participants who would like to ask questions? Please feel free to. Oh, we have some question in Turkish. May I request a translator perhaps to translate it for us as well in English? Meantime, Rabia, maybe you can also look at that. And if you like to raise your question by speaking, please raise your hand as reaction on your screen. I'm just screening, no one is raising hand. So let's begin from the Turkish question. Merhaba, yeah.
Is there an interpreter?
I can translate it.
Who could just translate it live for us?
Yes, let me check. So, yeah, yes. No, there is an interpreter. Can you hear me? There is an.
Yeah, we hear you.
Okay.
Yeah.
Yeah, I do see it. Do you hear me? I'm the interpreter. Yes. Do you hear me?
Okay, we will wait for the interpreter to translate it.
Okay, can you hear me? Can you please go to the English channel?
I was wondering, well, we would still request an interpreter to translate the question that is in the chat box to English. In English.
Sandra, sorry.
Yes, thank you. I can hear you now. Yeah.
Okay, perfect.
Okay, so my question goes to Rabia. Well, could you please explain the psychosocial impact in the results section, the impact of sentimental, cognitive, and behaviors, the impact of all of these? This question goes to Rabia.
Wonderful. Thank you very much. Yeah. Rabia?
Yeah. I heard it. Thank you very much. So I will explain this question then. First of all, the emotional effect of the pandemic appears in two ways in our result, positive and negative emotional effects. There were participants who stated that it was good for them to be freed from their responsibilities for a while, when they felt that their values were understood and loved during the illnesses process. However, Turkish Red Crescent employees state that difficulties in family relations and intra-family conflicts increased with the pandemic process. They also reported that, I will briefly mention about it. It's about the coping strategies. Then, in addition to emotional effect, that negative mood status such as depressive symptoms, increased anxiety, irritability, and sleep problems were reported more frequently. And migrants in the study state that they felt isolated, extremely stressed and angry before the pandemic, but they state that their anxiety levels increased with the pandemic. And transmission of the virus to others, care and education of children, and economic difficulties are among the reasons for the increased anxiety. Although they said that employees are often described as understanding because they allow them during the illnesses, but the reduction of salaries of participants for the days they work in quarantine made it even more difficult for migrants' family who were already struggling economically. So cognitive, these are the all emotional effects, but the economic and the status are really has huge impact on the emotional effect. So cognitive and behavioral effect in some migrants, delayed response, amnesia, and they state like decreased self-care. Also, if we look at the observation from the field, experts report that they observe an increased case of anxiety, reluctance, introversion, sleep disruption, anger, and domestic violence, especially during the pandemic process. So they stated that anxiety symptoms were associated with increased dismissal and difficulty in finding new job during this period. So these are all our emotional and cognitive behavioral effects. Is that okay?
Yes, that's very extensive. Thank you very much for explaining on that. If anybody has any follow-up question based on this, please feel free to ask a follow-up question. And we have hands up from Jalal. Jalal, do you want to ask a question?
Really, I have a comment that COVID-19, yes, created some problems, some psychosocial problems and effects. But there is a very important thing that it uncovers. It uncovered some things that were before COVID. I think, I know, I want to introduce myself. I'm a psychiatrist working in Gaziantep with the Syrian refugees. So there were some problems that we know about what COVID uncovered and what COVID created. The first one is the people really had bad relations because the men working more than 12 hours or sometimes 14 hours, then they don't know anything about their children, about their wives, what they are doing. And when they come back, because they are tired, they work on mobiles, then they have a bad interaction with their wives and families. So when they became 24 hours or maybe 20 hours with their families, they dealt with the people who don't know. So that makes a kind of anger, a kind of domestic violence, because we know that violence is created by not knowing the things. If we ignore something, we sometimes be violent. So they became violent to where their children, their wives, their demands, and when they feel, when we are talking about anxiety, what kind of anxiety? Anxiety because they haven't work and they haven't money to have bread for their families. These things really important to know. It is not created by COVID. It is only uncover the problems of the relations between the parents and the families, between the couples, the wife and the husband. That was really widespread and with a kind of domestic violence.
Thank you very much, Jalal, for your intervention. Yes, this is a very important point to remember. There's a range of pre-existing issues, and the pandemic has just exposed these issues, yes. And thanks for helping us to understand where this domestic violence, interpersonal violence might be deriving from. And I don't know if any of our presenters would like to add anything on the issue of family dynamics and interpersonal violence. If there is anything that you'd like to add to what Jalal has said. Or anything in relation to family and gender-based violence. Or, okay, if not, we can move forward. So we might have other questions. Yeah. Okay.
I can add something on relation. Mm-hmm. I am agree with what Jalal said. I already mentioned about the migrants in study. They already mentioned that they felt isolated, extremely stressed, and angry before the pandemic. So these are the participants saying, which is totally right. So, but I can add something else about the relationship, because there is huge effect of pandemic has emerged in the context of relationships. In our research, many participants reported that family ties were strengthened in this process, and family members had the opportunity to spend more time with each other and got to know each other better. So, in the context of relations with Turkish society, they mention about that, which is another sub-theme. The participant who stated that they often had limited communication before the pandemic. So they say that they were more excluded during the pandemic process. And within the scope of the limited social interaction, sub-theme, the inability to visit relatives, which is considered very important in Syrian culture. And together with the pandemic and the inability to go Syrian during the holidays create a complaining situation for many participants. As we observe that participants are complaining about not to communicate with their own nation. It is already all, I think participants mentioned about they were all limited communication with Turkish community. And it was also a great chance to me to examine these interviews for this research, because I was also doing this interview, and the participants say that we are not complaining about the Turkish community. We just get used to that relationship. Actually, there is a huge gap in that relations. They commonly state, how can we communicate? There is a language barrier. But some of Syrian participants also mention about, okay, I don't speak Turkish, but I can use my body language. So some of them find a way to communicate the Turkish community, but some of them not. But the thing is, they are not criticize the Turkish community, because all of them maybe have this conscious that I am a migrant to their country and they can have some attitudes towards me. I can understand that, and I can have I can occur boundaries from them. So actually, they have this consciousness, and they are not complaining at all about the relationship. But of course, it happens. Huge negative impact on the relations between the nations. This is all I can say.
Well, thank you, Rabia. Yeah, or Marlene, you like?
Yeah, I think I can also add something. I'm just like, something I want to say is how interesting I'm finding it that even though we have very different perspective on the topic and did research in different countries, it seems to be very similar outcomes. But I'm also finding it very interesting to hear your perspective on all this. I just want to add a few things. As we have heard now, sexual and gender-based violence has been on the rise since the start of the pandemic, and this is worldwide. And the reasons might be increasing socioeconomic tension, isolation, frustration, but also less possibility for victims to seek help. In Germany, for example, battered women's shelters, so places where women can go to get help, victims of sexual and gender-based violence can go to get help. They were occupied without the possibility to let anyone in many cases. Also, during the lockdowns, they couldn't let anyone in because of the contact restrictions. And then they also had less space to take people in due to the restricted number of people that were allowed in one room, and so on and so on. And they also only had access to tests rather late in the pandemic. So this was also a problem, that less women got to seek help. And additionally, even if they didn't go to seek help in those shelters, but in friends or volunteers or some kind of social contact person, they also couldn't do that for a really long time. So I think that was also a very big factor to all of this, that there was just less possibility to seek help. And that means that going forward, we need to ensure that there's also there are those structures, those helping structures in times of a crisis as well.
Yeah, thank you, Marlene, for turning us to the future and helping us, directing us to think about what needs to perhaps happen for us to help compensate for the conditions that have been created for the nations to be able to, rebuild, recover with inclusive approach towards refugees. Yes, making sure that refugees are part of this recovery efforts across countries. And thanks also going back to Rabia and yourselves and your comments about relational issues and yes, gender-based violence, but also relations between nations. I think this is a very important point. And we all noted, yes, in our own lives, we had to restrict our social contact, and we can only, we need to be reminded that this social contact that for us might be, we might take it for granted. For many people with restricted legal status or illegal status or temporary status, who are counting on social relations, social contacts in the communities as means for survival, because that's perhaps for many people the only way to gain support from neighbors or from community centers. It has been life changer during the pandemic, where all these bonds have been cut and suddenly people couldn't turn to each other. And naturally, it has an effect on integration and relations between nations, yes, mixing of settled and migrant communities. I know you have also covered, Marlene, in your study a little bit about discrimination and increased races. I don't know if there's anything that we should pick up on that. And I know we have only 30 minutes left, around 10 minutes left. Maybe we could also turn to discuss what needs to happen. And I invite all participants to think as well, looking at your programs and your sphere of influence, and broadly, nationally and locally, what do we need to do to help recover and mitigate the negative effects that have been created by the pandemic? What are there any suggestions for, what will be the priority? Is it, or how many priorities can we have at the same time? Is it health, education? I don't know if there are any comments, any suggestions from the audience on that. So I just opened that discussion. Anybody like to come forward to respond to it? Okay.
If not, I can start as well.
Yes,
I mean, I have already shared our policy recommendations generally, but I think it's also important to bear in mind that all these areas that I talked about are interconnected. So helping migrants in their access to work, it will improve different things like mental health, possibly will maybe be a part in fighting racism and so on, or education is very important for all the other fields as well. But I think very importantly, we need proactive action against racism, discrimination in all fields, because that is something that happens in every, we have that on the workplace, we have that in education, we have that in health, and also in housing, in the access to the housing market. And so we need to try and find ways to combat racism and discrimination in those fields. And that can, for example, happen by expanding multilingualism or by considering diversity in policy measures with, for example, inclusive, communicative and comprehensive measures. And I think as the topic of this event today, or of the topic of the event, is mental health, that we need to stress again that mental health and also physical health services need to be, migrants need to have access to mental health, and they need to be able to go through these processes if they need to.
Yes, thank you very much for pointing to those interrelatedness issue. Yes, all domains are so much interconnected, and progress in one area often has effect on others, and it's very important for integration, but also well-being and improving, protecting people's mental health to ensure progress in different domains. And there are sometimes unexpected ways for people to get better. Like in one area, progress can have a massive effect on improvement of entire families' lives. That's sometimes improvement of one person in the family can have an effect on the entire family too. I don't know if there are any other comments regarding future and way forward. Anybody from participants, or any other comments or questions questions to our speakers? Is there anything that has come to mind, or is there anything that you can relate to our speakers in your experience? We would be very interested to know who is with us. We have limited time to get to know who is with us in detail, but if there's anybody volunteering, that would be great. I see the meet, I know that's interpreter who has unmuted himself there. Okay. Please feel free to put that in the chat box or raise your hand, and I will continue the discussion. I meant to ask you, I was wondering also whether we have noted any differences in Germany and Turkey of COVID-19 effects on women and girls, and then men and boys. This is an interest of my study as well that I've done in other countries, including Turkey, but I've done my study in also Sweden, UK, Australia, and Tunisia. We had this gender lens looking at the differences that we tried. I don't know if there's anything that you have, Rabia and Marilyn, to share about differentiated impact of COVID on women and men.
I'll start, if that's okay, Rabia. I wrote my bachelor's thesis about the topic of the effects of COVID-19 on the integration of migrant women and girls. And so I'm trying to sum up a bit the results, but it is actually, it's a lot, and it's a lot more than you maybe think, but it's different factors that exacerbates inequalities, also inequalities in terms of gender. And migrant women are hit especially hard. This is due to intersectional forms of discrimination that meet each other and kind of create new inequalities in a way. There are different factors to this. For once, women who already had a much higher share of unpaid care work than men have taken on even higher care burdens during the pandemic. Due to school closures, for example, they were the ones often to take care of the children that were at home now. And this again affects, for example, their possibility to participate in language courses, but also puts them under more pressure and stress, which then affects the mental health as well as the physical health. Also, in a lot of cases, men are the main earner, and especially migrant women are less likely to be working in Germany. And then again, if they work, they are most likely to work in care jobs or in the health sector, where a risk of infection is very high. We also have the issues of caregivers in private households. In Germany, there are about 500,000 migrant women, especially from Eastern Europe, that work in private households, often taking care of older people. In the pandemic and due to the lockdowns and contact restrictions, a lot of these women were either not able to come to Germany, or they were locked into a household and had to risk infection while often being underpaid and also exploited, unfortunately. And last but not least, as we've already mentioned, the sexual and gender-based violence has been on the rise. But due to all these factors, the mental health of migrant women is affected adversely, and discrimination, racism, sexism, insecurity about the legal situation, isolation, socioeconomic factors, and all that have definitely had their impact on migrant women.
Thank you, Marlene. That's really helpful. Thanks for highlighting those issues and how gender roles have been a factor influencing women's workload. And yes, that's really important to understand. And in understanding mental health conditions of women and men, yes, it's important to look at the gender roles and how pandemic has affected their workloads. Thanks for highlighting other issues as well. We have a question here in the chat box. We would like to request a translator to translate for us. We are switched to English. We can probably hear you if you speak. Yeah.
Hello, I'm going to translate the question in the chat box now. Hello, first of all, thank you very much for all the invaluable information you shared with us. I have a question for Rabia Hanım. How have your beneficiaries used their faith as a coping strategy? How have they used their faith as a coping strategy? This is the question.
Great question, Rabia.
Yeah, the answer takes lots of place, but we have limited time. I will briefly inform you about what participants mentioned about. And for many participants, belief appears to be functional in coping. It seems that praying, giving thanks and surrender and belief in destiny help the participant to cope with problems brought about by the disease process. And as we all know that their background has been full of negative life story because of the migration, but they use religion as a very functional and strong coping strategies. And during the interview, I realized one thing. When they are talking about horrible or terrible memories for themselves or the experience during the pandemic, their facial expression, like they have the submission which reflects their facial expression. So they taught me that how religion and faith and belief are essential factor to cope with such terrible events or situation. Mm-hmm. They use mostly faith and belief as a coping strategy.
Thank you, Rabia. It turns out this is a subject of my PhD, looking at the role of faith in coping. So would you like to tell us a little bit more about what resources particularly help them to cope, of what religious resources they use? Are there...
Sorry. Yes. Can you repeat it? Sorry.
Yeah, I'm asking what religious resources help people to cope. Are we talking about what are the most frequently mentioned things? Is it prayer? Is it reading the Quran? Or is it fasting? Or is it a combination of everything? Do you know any further detail?
Yeah, it is kind of the combination of everything. They also mention about repeated praying, reading Qurans makes me relief, and I have this kind of feeling that it is destiny. I cannot change it, and I do not have control on it. So this is what's happened. I need to go on that way. I need to live in this situation because God gives give it to me. So I am. They say that I am welcome the disease because I do not have any control on this. So they are praying in 5 times, even they have a difficult situation for their physical symptoms are really high. So they have aches, they have a difficulty in breathing. But despite of this, they are praying during the illnesses in 5 times in a day. And they say that when I read Quran, I relieve so much.
Thank you, Rabia. We'll be wrapping it up. Thanks for highlighting the issue of meaning making. The religion often helps people to find meaning. There are lots of positives, but sometimes it can also have some negative effect too. People may often believe it can be a form of a punishment, the disease and other things. So it's a subject of further discussion. It would be lovely to exchange with you further outside of this session. So I would like to thank again Marlene and Rabia for your excellent contribution to this session and sharing the effect of COVID-19 on refugees in Turkey and Germany. I thank all participants for your participation and your patience, and we look forward to meeting you in the plenary in 30 minutes. This session will be closed right now. Thanks again. If there are any follow-up questions, I don't know if Marlene and Rabia would like to leave their contact details in the chat box, just in case if anybody would like to follow up with them, you probably are free to do so. And thanks again for being with us this morning on Saturday morning. Yeah. And I look forward to seeing you in the plenary. We will report back the main discussion points. Thanks again. Bye.
Thank you. Bye.
Thank you. Bye.
session of our 2-day conference between countries' perspectives on the mental health of Syrian refugees in Germany and Turkey. So now we have the time to reflect a little bit on the breakout sessions that you just had. So let's start with Hannah Attar. Hannah, please speak in English.
Yes, hello everyone. I'm just waiting that the screen is shared, or should I just start?
Hannah, we cannot hear you yet.
Okay. Can you hear me? No? Can you not hear me?
Ich kann nicht hören.
Okay. Can you hear me?
Yes,
you
now,
can hear me.
perfect.
Okay, good. Okay. I was just wondering if the screen is going to be shared, or should I share my screen for my...
It's shared already. We can see it. Thank you.
Okay, because I cannot see it, but okay. Then, yes, we had a very interesting discussion with Mays Al-Hamri and Ruwaida Abdallah. Mays is living in Germany, in Halle, and Ruwaida is living in Turkey, in Urfa. And like the main points out of the discussion were like women in Germany and Turkey are having kind of similar struggles, and especially Mays described it very well, that women are having the struggles within their own family because they need to fight, like they're mainly staying at home, but they are willing to learn the language. But like from the law, it's only allowed that one person is having the language course in the morning, the other person or the other parent in the afternoon, and like from the ways of family are structured, men are going in the morning and women don't have the chance to go in the afternoon because they are taking care of the children, so they are in a way isolated and don't have the power to go out because like they're mainly taking care of the children. She emphasized that this is not the case for every woman, but like for some of them. On the other side, they have a big struggle within the society. They are suffering racism, especially, she emphasized that especially women wearing hijab are suffering discrimination and racism. And this makes it very difficult for them, especially with respect to the integration. Like on the one side, the society wants refugees to be integrated. On the other side, it's very difficult to integrate if they suffer discrimination and racism and they are not having the chance to get in. This is the same for Turkey, even though the discrimination is different because it's not mainly because of the hijab, it's more about being a Syrian woman. And in both countries, it's difficult to have contact to Germans and to Turks. And this is also what they are like complaining and criticizing. Then another point of the discussion is the mental health support, which is very difficult for the woman because if they go to someone, they don't have the religious or the cultural background which is needed to understand their situations, and there are not enough fundings for translation. One like not very good thing, but still a good thing that was said is that women are isolated. It's true, but they see that they are not as much as isolated than men because women have the power and energy to go to women groups, to interact with different women. They are supporting each other. There's different women projects. All these things, men are not having them, and also has to do with the backgrounds of the men, that they're not sharing feelings. They are like kind of too brave to talk about their feelings. So this is one thing they emphasized. Also, Ruweida from Turkey said she met in Turkey a Syrian woman she would never have met in Syria. So this is good for supporting each other. And the main takeaways was that racism needs to be taken seriously, like the state has to do something about racism so that especially women have the chance to be part of the society. And then the state has to take care and make sure that women are able to join language courses, that there are enough capacities, that they're able to learn the languages even though they have to take care of their children. And like for us, Germans and Turkish, to always keep in mind that we are not keeping these women alone. This was emphasized that there are a lot of sayings and paroles saying, yeah, we are for integration, that we are welcoming them, but they are just words, nothing, there are no actions following. So they emphasize they really wish that the society would more interact with women and in general with the refugees. Like Mace gave the example, she knows women, Syrian women, they don't even know any German woman. And in general, more fundings are needed to empower women for the language courses, for what I said, the mental health supports, and so on. There were so many important and good points. I hope I got the most important ones. Thank you.
Thank you so much, Hannah. Let's continue now with the legal perspective. Sama, please.
So hello, everyone. We had a really very interesting discussion. So we had on board Inga Mates from the German Red Cross, and Damla Çelik and Mehmet Altay Sevnic from the Turkish Red Crescent. So let's say about the legal situation. So I divided it into, or the discussion was divided basically into two parts. So the first part was about the situation in Germany. So the total number of Syrian asylum seekers in Germany are about 800,000. So in the beginning, or let's say before 2015 and up to 2015, the majority would get international protection or would get recognized as official asylum seekers. But starting from 2016, most are getting only temporary protection. And there is another problem, the duration of stay in the reception centers, it's really too long. So it can take up to 18 months, and for families with children up to 6 months. And this is only the theoretical limit, but like many people do end up staying there much longer because the affordable housing is rare. And also another challenge people are facing in Germany. So there is obligation to live in certain areas, even for recognized asylum seekers. And this obligation can last for 3 years. And this might be limited for the state or municipality. And another big problem here is the suspension of the family reunification for people with subsidiary protection. And this can be possible, but only after very complicated bureaucratic process. Another big important point that's causing basically fear was the lift of the ban on deportations to Syria since late 2020 because of the political discussions that are also causing heated atmosphere and heated debate concerning the asylum seekers in general. So concerning the situation in Turkey, so Damla shared with us, according to law, there are people who get recognized as official refugees are interestingly only European, but as for non-Europeans, there are basically two protection status, the international protection status. People get referred to one of 62 so-called satellite cities, and they are obliged to stay and register there. The other status is the temporary protection status. So this was created especially for Syrians. As soon as it became clear there is no, like, let's say, soon solution for the Syrian crisis. So for the temporary protection status, there are no satellite cities and there are no interviews required, but obtaining the IDs can be challenging because many cities are stopping giving refugee IDs due to capacity issues. So because there are, like, the number of Syrian children is especially high, there is unfortunately also a challenge to access education. And so Altai shared with us information about the work permit and working conditions. So the work permit is limited only for a specific company or employer. And this is why many are not getting work permits, because the process can be complicated and the work permit can only be made online. And also due to additional costs, unfortunately, many work unregistered because of extra costs and complications on both employers and employees. So we had very informative presentation, and perhaps if you would like to get the full slides, this can be shared by the Al-Shark. And thank you very much.
Thank you so much, Sam. Let's continue now with the COVID pandemic. Yeah, the impact of that. Sandra Patek.
Sure. Good morning, guten Tag, marhaba, assalamu alaikum. So I will talk about outcomes of our discussion on the impact of COVID-19 pandemic. We had excellent speakers, Rabia Aljak, who is a clinical psychologist, and Marilyn Leisenheimer, a researcher from Germany. This was a discussion based on the studies that I have presented. First of all, we heard the extensive socioeconomic effects of COVID-19. We heard about exacerbated inequalities across different domains, from work, education, health. In health, there were mentioned physical barriers, registration issues, language barriers that have exacerbated health inequalities, and even restricted access to COVID-19 tests. We also heard about, in Germany, that was from Merlin, that inequalities in access to digitalization. So we hear of this digital poverty in COVID-19 when we shifted work to working online, learning online. Some people have faced major difficulties in accessing these services online because of lack of access to internet and costs related to it. We heard about inadequate housing, and when perhaps social isolation was difficult, there was also an issue of limited access to hygiene items. We heard of profound mental health effects. They talked about, here mainly Rabia talked about psychological, relational effects, including emotional and cognitive consequences. In terms of relational, she mentioned issues around family dynamics and tensions, community relations and tensions. We talked about increased isolation and its effect on increased anxiety, irritability, resulting and other effects of mental health nature, such as irritability, amnesia, decreased self-care, and so on. Rabia mentioned also a range of coping strategies. She highlighted an issue of religious coping, which proved to be one of the essential coping strategies among Syrian refugees in Turkey. It proved very effective, and it helped people to find meaning and relieve anxieties. She also talked about active coping, such as wearing masks and sanitation and all that. We heard of interpersonal conflict and family dynamics, an issue of increased domestic violence, and one of our participants mentioned issues of pre-existing issues, that COVID-19 has just exposed issues that have pre-existed COVID, meaning families maybe didn't know each other too well, and being forced to coexist 24 hours a day could increase tension in the family and between parents and children, and within and between spouses. Victims were said in Germany as less able to get help, and access to self-shelters was limited due to contact restrictions. Main takeaways. First, Merlin has has underlined the issues of interconnection between different domains. So progress in work, mental health, and education will have like associated effects. So we need to take positive measures to mitigate negative COVID-19 effects across different domains. In particular, there's a need for proactive action against discrimination and racism. We heard of the need to facilitate access to mental health services as essential. We heard of gender differences. So gender roles have affected perhaps women in higher degree than men, but not on. It's just not it's not generalized. But we heard of increased unpaid labor burden on women as frontline workers, as well as increased domestic work and so on. So to summarize, COVID-19 uncovered some previous issues and created new issues, exposed relational challenges in families. There are multiple new daily stresses, such as not being able to visit relatives and travel to Syria, limited contact with Turkish community that affect people's mental health and interrelated. Thank you for your attention.
Sandra, thank you so much. Yes, someone asked, we are currently running about 5 minutes late, but we have one last presentation on the issue of, is there a unified Syrian community in Germany and in Turkey? Sami, please.
Thank you, Leo. I will keep it as short as possible. I talked to two persons, so two individual perspectives. Saad, who's an artist and author living in Berlin, Germany, and Mohammed, who's a former English teacher, now psychology student, and works in several years for NGOs from East Turkey. So, and we talked about the structure of the Syrian community and the interaction between the Syrian communities with the majority society and how the communities are formed and how actually the life of the Syrian communities can be improved. So, and regarding the main question, which is the title of the breakout session. So Syria was some kind of melting pot before. So you have many different norms, religious backgrounds. You have Sunni people, Shia people, Christian people, Druzes, Alevites, and so on. So there wasn't even one community before. So before the war started, or there is no one community currently. So therefore, the answer from both Mohammed and Saad was the same. There are several Syrian communities in Turkey and Germany because it was the same in Syria. So they formed based on their norms, social backgrounds and traditions. And this is something they wanted to point out. The society, the majority society must acknowledge and accept this diversity. Yeah? So you cannot treat every Syrian the same. Yeah. And in addition to that, they wanted to highlight and point out that within the Syrian communities, the people are lacking trust, and many of them have traumas and psychological issues. I mean, we heard about that a lot in the other in the main panel and the other breakout sessions. So you need to gain their trust. You need to rehabilitate them. What are their suggestions for improving the situation of the Syrian communities? What do you need to do? So first of all, they said you need to literate the people in terms of politics, civil society, women and children rights. This is something the people didn't know or didn't really live in Syria. So they don't, or they are overwhelmed by having many political parties, by gatherings, by initiatives and so on. Civil society, they were not really teach about women and children rights. This is something new, and you need to educate and literate them in terms of that, and especially do this in their mother language so they can really understand it, process it, and develop these topics. And you need to activate the Syrian people for the civil structures in the new country. Both of them pointed out the topic of civil engagement, voluntary work, which is in both societies something which is actively conducted by the majority society. Try to bring in the Syrian people for doing the same. So let them get in touch with the structures and let them be part of this civil engagement. And last but not least, so I think this is a good closing the loop to the other breakout session we had. They said you need to activate the women as change driver because they raise the the children. This is something I would like to point out also from a personal perspective as working for an NGO. Also in our work, if you want to drive change, or we want to drive change in our work, you always have to put the women in the middle, because they are the change drivers. If you really want to break up something, improve something, put the woman in the middle. And yeah, I think this is a nice closing of the breakout sessions.
Sami, thank you so much. Well, then let's move on to the last discussion. But let me just announce one last thing before. Unfortunately, it seems like we won't have a video by Ahmed at this point due to connectivity issues. We tried a lot and he tried a lot as well, but it didn't work out yet. So unfortunately, we won't have the Turkish perspective on here today, but yeah, thank you. Then let's move to the last panel discussion, which is kind of looking for meaningful connectors between the offerings and the actual needs of refugees in Turkey and Germany. And let's start with an introduction round. It's a similar structure than in the first panel discussion today. So we'll have Nicola Klamt and Sabrina Schmelzer from the Zentrum Überleben first, who are presenting together as so they'll start. Please go ahead. You're muted.
Yes. Hello. Perfect. Can you hear us now?
Yes, I do.
Okay. So we are both colleagues from Zentrum Überleben. That's an NGO based in Berlin, and we offer psychosocial support, rehabilitation for refugees, for migrants with a story of experience of violence in wartime or survivors of torture. We are one of the 2 psychosocial centers in Berlin. The other one is Xenion. And maybe you remember the organization was founded in 1992 already under the name of Berliner Behandlungszentrum für Folteropfer, also Berlin Treatment Center for Torture Survivors. At that time in the context of the war on the Balkan and the emerging need for psychosocial support for those affected people. So I will hand over briefly to Nicola, who will give you an introduction in our departments at the center.
Yes, hello everybody. My name is Nicola Klamt and I'm a psychological psychotherapist since 3 years at Zentrum Überleben. Yesterday in the breakout session, I already gave a brief, detailed overview about the center. And just from yesterday, I think there was a small misunderstanding in the translation. I just wanted to correct one thing, that like we have mostly patients from Syria, then comes Afghanistan, then comes Iraq and Iran and so on. And nowadays we don't have anymore so much refugees from Chechnya. I just wanted to correct this a bit. And we have different departments. So we both work in the outpatient department for adults. Then we have the same outpatient department for children and adolescents, and then we have a housing community for female migrants, and we have the Berlin Network for Vulnerable Refugees in Need of Protection. And maybe in the discussion we will take also a closer view to this department because it has some interesting topics, I think. Then we have many other departments. We have a school where you can get a training in nursing and such stuff. And we have a big research department, which plays a role in developing also online tools for treating refugees. So, for example, they have developed an app and they also have a full therapy program where you just need a computer access to get a therapy. So it's mainly for people who are speaking Arabic and not being in Germany, so not being able maybe to get a psychological therapy or something. And then we also have a special library, which gives us information on every topic surrounding trauma or torture or war-related violence or treatment. And yeah, overall, we grow kind of bigger in the last years, and but also we see that the amount of people who needs psychological support, social support is also growing bigger since probably also a lot since 2015 also. I think, I don't know, this is enough for a small
I think it's enough. What is maybe important of that we offer rather high threshold specialized services. We also have a day clinic for the more severely affected, and it's not like a low threshold access. So we really invite people for a first interview, then we take a decision if they fit to our criteria of being survivors of torture or war traumatization, if they show symptoms of mental distress, such as PTSD symptoms or depression.
And therefore also the asylum status needs to be quite safe in a way, which is why we have a lot of Syrian refugees in treatment in a way through the subsidiary status. It's in a way more easy to do a trauma therapy instead with somebody who maybe faces deportation. So far from us, I think.
Thank you too. Let's continue with Mays Alhamu.
Yeah, hello everyone. I am Mays. I live in Halle. I come from Syria. I've been here for 6 years in Germany, and I work in an NGO called Multicultural Center, located in Halle, Magdeburg, and Dessau. And I work in a social work team and with women and with teenagers with migration background.
Yes, you can go on.
Talk more about more about my work.
You have the chance to talk a few 5 minutes or something about your work and introduce it a little bit more in detail.
Yes. So the work that we're doing with migrants, teenagers, is in a project called Our Lives, and we try to address the different issues that are having, like integration, finding identities, religious identities. How can they cope with their families? They're changing faster. Usually, they are more adapting to new system, and the families sometimes they have the struggle of just mostly keeping them a little bit like. In traditions or in old systems, and the teenagers wants to have a new life, of course, and they change faster. I would say there's also like a change in roles in families because they learn the language as well faster, and the parents a little bit slower, so they kind of it change out the power as well in the family, and we try to address such issues with them to empower them in their daily life, to support them to find their own ways in Germany. That's on one side. On the other side, I work as well with women in different empowerment projects. So it's kind of social support that we have women circles, we have some safe room that they meet on a weekly basis and do different activities. As what do they want? That's on one side, that they could also get to know each other more, and they can share problems and also solutions for things, and they can also form relationships so they feel more supported and they have networks. Or on the other side, I try my best to connect them to the services, because there's always this puzzle missing. How do the offers, how do the people that are doing things, how do they can be connected with the group that they want to work with. That's so it's like a bridge function or something. That's what we try to do.
Yes, thank you so much. Well, I think we have one. Yasin, the next speaker, is unfortunately not in the call at the moment, but we'll get back to him as soon as he joined. So we have the chance now to go into the discussion a little bit already. And one question that I'm really wondering about is the role of family members as potential connectors. How important are family members in bridging or kind of in mental well-being for refugees in your experience and in your work?
Who wants to answer it? I don't know. Mais or as a social worker? What I can say is that family members are important for all of us. Of course, they're very important for the refugees as well. And one of the main issues is that many people are not together with their family members. They're not reunified. And this is one of the main stressors, I would say. I think we can agree on that. And with the subsidiarian status, which most Syrian refugees get in Germany, is very difficult, very bureaucratic to get their family members. Often the men, the fathers, they go ahead and have the ideas that they can bring their spouses, their children as soon as possible. But then the process takes months, sometimes years even. And I've seen people getting severely depressed because the family members are not there. So that's a big issue. And I mean, we all need our social network, our friends, our family to feel mentally healthy. So it's very important to have them around. And many of the refugees don't have.
So can we kind of note that family members are an important connector that can often play an important role and is often in many cases missing as a meaningful bridge in order to reach mental well-being.
Yes, for sure. And on the other way, we see in a way we have many children treated in our children and youth department who are kind of, we call it Parentifizierung in German. So they take the role also of a parent because they sometimes learn the language much quicker in a way. They go to the school every day. And so they have to take, in a way, the role of their parents in everyday life, which is a huge stress factor for them also in their life. And they get grown up quite soon in a way. And for example, I have been with our NGO on a children travel with the children of our patients. We do this every year, and I could go with. And the children are perfect in German. It's kind of like mother tongue in a way, which is my respect for this to the children. But in a way, you see them coming to the offices, dealing with difficult stuff. So it's also a stress factor for the new generation then in a way. No?
I would also add that it is important. Exactly what you said, Sabrina, right?
Sabrina, yeah.
That it is like they are, and then they not only learn the language very fast, the children and youngs, but they also get into the culture and the mentality.
Yes.
And they really change. They really change from the parents. And then I think it's very important, the family members, but also the family work is very important.
Yes.
That we try to work on the family dynamics, which I see that even in the very well functioning families, when they are in this context of migration in Germany, they have so much now challenges with the children because of this the new challenges in the guest community, I would say. That's as well very important.
Yes. That's why we mostly install in the families like a family help or a single case help, no? And still, we are in a way in a luxurious position in Germany, although it doesn't feel like this a lot of times, but at least in Berlin, it's even more luxurious situation than probably being in Halle, because the networking structures are quite good. We have a lot of treatment possibilities in a way, although sometimes here even it doesn't feel like it. But even though you install family help or single case help through the, I don't know, government youth office or how you call it, it's still not enough in a way, no?
Yes, yes, because it misses this cultural aspect of it. There are not enough professionals working with the Jugendamt, youth.
Yeah.
I don't know.
Jugendamt.
Yes. There are not like enough professionals that are coming from different, like from a migrant backgrounds, that they could even like be active and work with these families, because the cultural understanding is missing, kind of.
Yeah. So I think it's two different issues. The parents, which come first, which feel guilty about not having brought their families or not being able to reunificate. And the second big issue is the difference between parents and kids in the speed of integration and change. And that also creates differences and problems.
And also for the parents, in a way, it has been like a forced migration, no?
Yes.
It's not that they choose, in a way, to come to Europe or to Turkey in a way, no? It's, in a way, you had to leave. And then also the parents are stressed in a way by seeing their own countries falling apart. If you check Syria, no? Like you have, I don't know, there are probably like not many doctors remaining in a way, or not many teachers are remaining, and so you have still your family members there, but the country is in a way falling apart. So it's definitely, in a way, it's a protection thing, the family, but in the other way, it's also a big stress factor. So it has both sides.
Yeah.
Exactly. That's what I also wanted to say. That a lot of my friends say they really wanted to get their parents here, and they got their parents here. And when they're here, they are happy that they're here. But at the same time, the stress that is just developing from having parents who are from now very different contexts, it's also big.
Yes.
Another factor that I was wondering about is in what way are the needs of different generations that you're working with. I mean, you mentioned the parent generation, children as well. Like in what way are these the needs of these different age groups different in your opinion?
Can we see all of us? We can't. Sorry, a technical question. Can we see all of us? Or is it not possible?
No, it's because we are in this small scale account, so we can't in a way.
Okay. Sorry, I was just thinking easier for the communication. Who wants to answer?
Mace, do you want to?
Maybe.
If you have something to say, please.
Yes. So is there a difference in generational needs, basically, between younger generation? And I mean, there's also another aspect, of course. I mean, we know that trauma, for example, is kind of moving from one generation to another as well. I mean, how are kids maybe affected of people, refugees who have migrated to Germany, and you might work with them now as well, I don't know. But I think, I would like to find out more about how you see these different generational needs. And
Also, for us, for example, the parents who have to flee the country and maybe have experienced trauma, and they find the way to our center in a way, and they get a trauma therapy at our center. It's always that we are, for example, doing a children monitoring. So it's basically every 3 months in a way. And we also check the situation and the needs of their children, which is sometimes, of course, very difficult, as there is a lot of times the opinion if the youth department, youth office of the state, let's say, comes in, then they will lose their children or they will take the children away, which is like a belief you really need to work on hard to destroy this belief in a way, so that the youth office can also offer some good help in a way. And there are many anxieties you have to deal with the, let's say, elderly generation or the parents in a way. So it's very important, besides therapy and so on, to give a good overview about how the society works, how structures work, what they will face in a way as, for example, also racism in everyday life and so on. So you need to give a good psychoeducation on these things in a way. And then the children, they are more having the need, as I see it, to have their time for their progress in a way, and for not being the second mother or father at home. So maybe you can.
I think the parents now, because I just work with parents, with the adult, as a psychiatrist and psychotherapist, a lot of them suffer a lot of what they have lost. Okay? One thing is the traumatic experiences they had during the war, or they have been in prison. But the other thing is the loss of status, the loss of everything they built up in their life. And this often leading to depression. I think that's a bit different to the kids, and also to change the cultural environment totally. I mean, when you're 50 years old, it's different, more difficult to change than if you're 15 or 10. It's a different phase of development of your psyche. But many of the older ones, the parents, they're very sad about what they lost. Okay? And it's more difficult for them to integrate, to learn the language, to learn something new, okay? To adapt. And they feel responsible also for the children. For example, if I'm imagining one of my clients, he feels very bad. He used to be a hard worker in his home country. He had 2 houses. He says he had 4 cars. He was well off. And now he can't even provide the simple thing like the housing for his family. So he says, we have 2 rooms with 4 children in a common shelter. And he really feels bad, depressed about not being also able to offer as a family father. Okay? What is his duty, especially in his culture? Okay? He's responsible for all of that. So this is more from the point of view from the father. If you want to
add something.
Yes, I would say I see it exactly how you see it as well. And then if we want to say that the parents are overwhelmed, they are overwhelmed by this bureaucratic system and the posts they're getting, the things they have to do, until they really could do anything that bring them hope, anything, successes like language course or getting a job or practicum or anything, that they are on the way and the right way. This is also very overwhelming. And it's also, as you said, it's then difficult for them to this role of being a parent is a little bit different here. It's now not so, they don't feel so strong in this role, and they really need a lot of support in their role as parents.
Yes, I think what we are all missing in a way are interpreters, no? It's the because the stress, also the after migration stress is all this, that you can't read your documents, that you would need like interpreters. And I think with this you could reduce the stress level quite a lot in a way. Yeah.
Mace, I mean, we touched upon that before a little bit as well. Like when we think about differences between small cities and medium-sized cities and bigger cities, what I think Zentrum Überleben is in Berlin, and you're in Halle. Like, how are the challenges and needs and also missing connectors different in your work in Halle compared to a larger city as Berlin?
I would say really in general, I see that there is in the migrant community a mental health crisis. It's really a crisis. I mean, we have clients that they don't speak German at all, and they have to be admitted to a psychiatry, but because also there is no support for translation. There's no funding for translator, for professional translator to be in the psychiatry with them. It's very difficult. And then we try, like in whole the state of Sachsen-Anhalt, there are no professionals who are Arabic speaking, for example. There are no professionals. And there's as well no funding for it. And there's in Halle only one center, it's called Psychosocial Support Center for Migrants. And if they are really doing great job and they're getting like cut on the funding, they're just getting, and I don't get it, and they have a waiting list that is so long. You really need MAF to get in there because they have translators, kind of. And then we find ourselves calling Berlin, like most of the time, somewhere in Berlin, because we know that they have translators or they have professionals that speak the language. And still there, we don't get place. And I know clients that we have for 2 years till now. They could not get the help that they need. And I would say these are for the people who are aware that they need help, who are having like some kind of post-traumatic symptoms that it's keeping them from having a normal life. I think there's for a lot, also like another problem for migrants, I would say, this psychological education, that they realize what does it mean to have therapy. It's also very important. There's a big stigma around it. They're stigmatized and they think mostly they have the idea that you are crazy if you seek help. Like they even use the word crazy a lot if you seek help. So if you want to start, I would say that the crisis starts from the beginning, that there are not enough education on this, that you could actually get support. And mostly, of course, it's difficult, but that it is good as well to seek for support, maybe. This is also like something I find is really unfortunate. And also another also aspect of it, I feel like there's a lot of people, like the family members of people, that they have like psychosis or something that's very, for example, very extreme, I would say, that it's not kind of depression or like something that the family member is acting very different. In this moment, they don't know what to do usually. They don't know where to go. They don't know if they can call the police or not. They don't know what can the police do. They are very overwhelmed with this, and they are actually, I heard a lot about cases, they're encountering this, and like there's a lot of families that encountering that they don't know what to do. So it's again about awareness. What can you do in Germany and where can you get help on one side, and maybe, as well, like funding, because we don't have like good funding for services in the city where I live as well.
Yeah. Do you want to add something to that, Nicola?
I mean, we have the German security system. No? You get a card in a way, which allows you to get a therapy in a way, as every other member of this, state in a way. But the reality is that then there is no translation, no? And that the psychotherapist, for example, if he or she wants to take somebody in therapy and can't do it in English, for example, this I have done with Syrian refugees in the past who were quite good educated, and we both could do the therapy in English in a way. But if not, then you need to pay a translator, and it's normally like it could be starting from 50 euros to even 60, 80 euros what the translator would get for the session. And in Germany you get something around 98 euros per session. So if you make your accounting, you can't pay the rent for the praxis if you treat refugees in a way, if you need to pay the interpreters. So basically, by law, everybody is kind of the same in a way. So everybody is equal. But if we see it in praxis, then there's a big gap between the people, because some can get therapy and some can't get due to language problems. No? And this is the gap we are trying to fill with the therapy in the center. But if we look at our numbers, we are treating around 500 people per year. So it feels a lot, but in a way, if you see the numbers of people arriving here, it's not so much. And there's a there's a big problem in a way. And in the last years, we had some developments of this kind of apps where you can find help if you are in a struggled situation, and they work on smartphones, so it doesn't matter where you are, but it's a small-scale help in a way. And then some are developing these online programs, of course, but still, also MAIS told me that it's very difficult to apply there, and I know that they are also kind of full in a way. So,
it's a matter of, like you said, MAIS. I think first there's quite a difference between the land, the countryside, and the city, the biggest city, but resources are still scarce, also limited in the big city. Also, it's much better. But how do we reach the people, or how do they reach the services? Well, I think first in the arrival centers, is there somebody to really clear people with mental health symptoms already, who are in need of some services? Then is there somebody to tell them where to go, where they could address? If they get some counseling, are there places to be offered at all? Are there resources? So it's I think one has to start from the very beginning, because as you say, Mais, people are not aware. They are worried to get a stamp of being crazy. They don't even know the symptoms, maybe, if they are really getting crazy, or if it's a symptom of post-traumatic stress. So it's important to let them know about the symptoms, but also to raise the awareness that there can be help for those symptoms, that there are normal reactions also to horrible things they went through. So the question is always where to reach the people, how to mediate to offers, and then how to create enough places. And always the narrow point, as the needle eye, is the lack of language, also interpreters, the lack of translation. Yeah.
Before I would like to open the floor to questions from the audience, one announcement, I guess Asin will unfortunately not make it, so we'll have to excuse him for now. But another issue, and I mean, you really talked about that already, is this issue of stigma. And what could be ways for, trying to think positively to overcome this stigmatization? What could work? And maybe do you see progress already?
Would you like?
Sure.
Yes.
Mace, go on.
The question is how, because the internet was a little bit cutting.
Regarding stigmatization, what could be done, in order to effectively kind of work on destigmatization? What could work?
What could work effectively? Yeah. I think part of it, like the job that we're doing, when I'm getting to know women, of course, it's recurrent that we get a lot of problems. I get a lot of that. They're having nightmares, or they're having some fears, some anxieties. Somebody's not feeling well. You can see they're depressed. They are not coming to the meetings, and I can see that they are kind of suffering. So there's this conversation going on that, okay, maybe what about I'm doing therapy, or the other person doing therapy, they are doing well. This organization maybe is getting a little bit money for translators. Maybe we can see the center. So we try to have this conversation with them that is like, it's normal. And I feel like after war and after all what happened in Syria, even in Syria, people are getting a little bit more open about it. Like a little bit. There's now people are start saying, yeah, I'm doing therapy, kind of. Mm-hmm. And this you never heard before. I think now, so I would say partially it's the social service. It's like a social work thing. People, even when they are like, as we said, this education should be provided in the Unterkunft where the refugees are, maybe, and also in the work with
with a youth center, with the families inside them. Also, maybe the actors from the society themselves, from the refugee society or the migrant society, that some people who are very active, that they maybe bring the subject, I guess. But again, we say if they find a place, because even if we talked about it and then they don't find a place, that's really an issue. So I would say it's going to be even more difficult when we say they want to seek help and they don't find a place in Halle. I mean, that's
important aspect. Do you want to add something to that, Sabina? Or
no, I mean, stigma is an issue, I think, in all countries of the world. Stigma of mental illness, mental disorders. So I think anti-stigma campaigns concerning mental health should be done all over. Maybe in the media, more in the internet, in social media, reaching young people. This is not just about post-traumatic stress, it's about suicide, about psychosis. People know something, and I agree, they know increasingly, and it becomes less stigmatized, but it's still there. Yeah? And I mean, having to leave your country or having experienced horrible violence is not a mental disorder. Sometimes we also make it. Yeah? I think that's also important to tell the people that's also somehow normal to react to those horrific events.
And also it's about like being stigmatized as a victim, maybe in a way. And although you had a status in your country, what Sabrina said before, like you had a job, you had a house, you had cars, whatever, and now you are stigmatized in a way as a refugee, as a victim, and this is something which definitely you need to talk about with the people. And for example, in Germany, there is this word like Flüchtlinge, which is something which is like, Linge is something we say to make something small or, I don't know, sweet or whatever. And it starts also by you in everyday life in a way to maybe the word like Geflüchtete. Another word for refugees in a way is something which gives also more respect in a way, or instead of saying the word Flüchtlinge. So it also starts with small things and the explanation of these things to people who are living here.
First question from the audience that I'm asking you now. I'm asking another one afterwards. From Romia, to what extent is one problem that native Arabic-speaking therapists don't get their diplomas from their home countries recognized to provide therapy themselves? Is that a significant aspect or not? That is the question. Mace, maybe you want to...
I think Nicola and Sabrina know about this more than me, so I would ask you both to answer.
I'm not so sure about it. No, I just know that as being a psychotherapist in Germany, you have to go like a long way. So you have to finish psychology, and then afterwards comes a very expensive education, which you basically need to finance yourself in a way. So you need to either have rich parents or you take a credit. No, that's the reality. So, and we are talking about more than 20,000 euros. So I think this is kind of also already a barrier for people in a way. And then the recognition of the diplomas is a big thing in Germany. No? And we are a super bureaucratic country, so why should this be easy in our country? Of course, this is also super complicated here. And yeah, for sure. No? But also to be, I don't know so many people who have studied psychology in other countries in a way. So in countries like Syria or something. I think it's mostly the psychiatric point of view you take. And psychotherapy is something random in a way, as far as I know, but I'm happy to learn something new. So.
Yeah, for the doctors, it became a bit easier to get their certificates because we are in need of them. So, of course, it's very important that these bureaucratic processes are made as easy as possible. And the language issue, of course, is an issue, okay? That high levels of German language are usually expected to get your certificate. So maybe that could also be another path, that we are in need of therapists who speak their mother tongue, of maybe psychiatrists or social workers, as people who has been working somehow in the field of mental health in their home countries, that maybe even without the high level of German language, they would be allowed to get a certificate to practice, or be a bit more flexible in it. It would be something good, definitely. But it's a bureaucratic path.
Let's dig a bit deeper there. I mean, or to what extent then is language really important as a factor in therapy? What is your experience there? Is it very important for the therapeutic experience that it's conducted in the native language, and in the case of Syria, probably also in the native dialect? Or is it sometimes even helpful to distance yourself linguistically from that? Yeah.
Should I answer it?
Sure.
Yeah, I mean, for me personally, I'm a psychiatrist and also psychotherapist, and in the center, I just work in English, German. As a German, we don't use, because all people come from abroad. So in English either, or I work with a translator. And I was surprised myself how well it actually works to work together with a translator, because I also get not just the words, the literal translation, I also get a bit of cultural translation, which I find very useful. So ideally, we have a short debriefing after each session, and we can discuss also a bit the cultural issues, maybe what was appropriate, what not, because I come with my German ideas. So I think the language issue can be solved with a good interpreter at your side, maybe coming from the same country, same cultural background. And we in our center, we try to have a pool of translators, which we also train, which we know well, and a certain translator you can work with. So if we have good translators, trained translators, it works very well. The other thing is that you're a therapist coming from the same country. So you can speak in your mother tongue. Of course, that's ideal. Yeah, but that's not what we have so much. Of course, if we have some among the people coming, we should make their what they know. We should make it available, of course. Yeah, with reducing bureaucratic obstacles.
Yes.
I would like to add something to this. I mean, I also know from the Syrian community that they are trying now to seek help online from therapists that are located in Lebanon or in Syria or somewhere. It's also kind of working, but some, for example, like, of course, we also in Syria, we have also our struggles with therapists and the whole idea of it, because like some therapists were like working with the security forces, or if you said something political, they could say that it was also difficult in Syria, or somewhere like religious, or somewhere sexist, or there was different struggles, and it was very difficult to find a therapist who's really good at their jobs, because it's not funded, it's not supported by the state. It was very difficult. Mostly they were people who studied abroad, and then they came back to Syria and they wanted to make a change. There were, but it was a little bit difficult. And now, like some of the people that I know, they are doing some online sessions with people like abroad, and of course they are funding it themselves, so they have to pay for the sessions themselves, because it's not in Germany, so they need to be working and having the money, otherwise they cannot afford it. And because they are really in dire need, some are like getting therapy from like a therapist for children and youth, but not for who are like professionals with youth and children, but not for women, for example. But they need any kind of support.
What we also sometimes face, but it's not the common case, but I also have many patients who are mistrusting any person with an, I don't know how to say political correct, but with an Arabic background in a way. So it's sometimes for some persons, especially if they had like trauma with torture and so on, it's sometimes more easy for them to open up within a person who is not from the same cultural background in a way. And also sometimes I have to change the translators, or I have to change to somebody who is, for example, studying Islamic studies or something, who is German but learned also Arabic. And sometimes with some people, they are so deep in their mistrust that I need to change the setting also. That's also something which sometimes happens. It's good to have both in a way.
To what extent would you say that like cultural awareness is or intercultural awareness for context-specific therapy is already anchored strongly enough in psychotherapy in Germany? I mean, especially when it comes to education. Could you hear me?
Can you repeat it?
Yeah, I was. My question was related to kind of cultural specific aspects of psychotherapeutical training in Germany. Is that anchored strong enough in the education already, in the training, or is that something that should be improved?
Also, for like, it's definitely a big topic in also the education of getting a psychotherapist. For example, culture sensitivity and culture sensibility is a big topic. I think for therapy, it's always the case that you have a neutrality obligation, like you are committed to neutrality anyhow. It doesn't matter if the person in front of me is from Syria or, I don't know, from Saxon, whatever. Like, I'm supposed to be neutral. And if you work in this business, it's always about like questioning your own perceptions and your own self-produced barriers or your own biases, and to know about them. And I think the important thing for our work is to accept differences, to accept irritations, to accept ambiguities and contradictions, like because this is what you will face in a way, of course. Like I got a totally different socialization, and I think this is the quality psychotherapists, psychiatrists should have if they work in a clinical setting anyhow. And I don't know, Mais, maybe you can
in our organization, we also offer such a training. We do training for professionals, for police, for social workers, for therapists. It's exactly about this culture education, and I find it really important and really powerful. And through also this education that we do, this conversation, we get a lot also like from for the experiences that I am doing. For example, I just remember that once with the police we had like also such a discussion about also culture, religion, Islam, and a lot of different things. And they said that for them they see that a lot of people, they end up in jail, but they think they just needed a place in a mental health institution, and because they could not find a place and there's no interpreters, they do another problem, and they have this Anzeige. What is Anzeige in English?
Anzeige, announcement? No, or I don't know.
From the police. Something from the police. The police. Yes, something, and they get it again. They ended up in jail, for example, and they think that all of this should have just not happened. because they should have just found a place and got therapy, you know. And it's not really in the tema, I'm sorry, but I just like remember through this training that we're doing with professionals that this is also something that they talked about and they really highlighted it.
Well, let me move on to the next question. And I mean, that is about hope, basically. I mean, Christina was asking it. This morning, someone mentioned hope as one of the aspects regarding expectations for today. What gives you hope in your work? And what gives your clients hope?
Question for Mice, I think, definitely.
I would say what gives me hope, I just talked about it when I was like in the other room about female perspective. I said, it gives me hope when I feel like, when I get to know amazing women and I feel like though they have so much struggles or traumas and they suffered so much, they are so strong and they are so amazingly powerful, and they're trying to move on in life and they're trying to get the best out of it. And that gives me a lot of hope, actually. And also, when I feel like I could talk with Syrians from different political backgrounds, from religious backgrounds, we could talk about politics or any other controversial subject, and that we can actually have a common ground. That's that gives me a lot of hope. And what gives them hope? I feel like this togetherness, that they are not alone in this, that they are with each other, that we are all together, that there's still, I believe in good in people, and I think when we are like together trying to do the best for each other, then there's also this belief that there's something good in this life to struggle for and to do, I guess. Yeah.
I think we can very much agree with what Mai said. I hear quite a lot from people coming. It gives me hope to be able to talk to you again. You give me some form of a perspective, even if you can't solve problems like immediately. But there's somehow hope again to get out of it, to not be alone with it. And sometimes when somebody calls me maybe 2 years later, I think, oh, maybe there's a crisis. No, I just wanted to call you to tell you I'm fine, and ask you how you are, and I'm asking about the children and the work, and then this gives hope. Yeah, it gives hope. That's something has been working, and there's a future also.
Well, thank you so much. I think I don't see any more questions, and I believe, hope is always a good ending point, despite all the hardships we discussed. Thank you three so much for your really insightful participation. And again, sorry that Ersin couldn't make it, but I hope you all enjoyed our session as much as I did. Thank you.
Yes, we did. And Mais, I just wanted to tell you, if we should get in closer contact in a way, don't hesitate to contact us. You have our email address and so on.
Thank you. Yes, thank you.
That are the meaningful
concerning the networking.
Yes. We aim to create here. So
thank
of course,
so
that's true for anyone else as well. I mean, if you want to get in touch with others from who participated here in these 2 days, just get in touch with the organizers, and that's great. Let's have maybe a little wrap up and look at the main points that we discussed during these 2 days. Yesterday, I think the main takeaways were that meeting basic needs and protection is crucial. I think we can all agree on that, and that interpersonal and environmental dynamics continuously impact the mental health situation. Then trust came up repeatedly. It was very important yesterday, but also in many of the sessions that we had today. In different ways. I mean, of course, also finding the right balance of closeness and distance for mental health providers. but also, of course, overcoming stigma and gender aspects and boundaries, setting boundaries, of course, as well. And that it's really key to install and maintain a feeling of agency for people affected. So today, then we shifted the focus a little bit, and we listened to the personal stories of two Syrians in Germany, Razan and Abdullah, and learned about issues of accessibility to basic needs like housing, jobs, languages, language issues, of course, that the acceptance of certificates can be an issue, that they made discriminatory experiences while living in Germany, but also about their personal growth and effective support offerings and self-help, and how such offerings could be promoted better as well. And then we moved on to the breakout sessions today. We talked about female perspectives, where it was emphasized that racism needs to be tackled more, that the state needs to make sure that women are able to participate and that they are not isolated in their life in their new homes. So access to language courses, for example, is very crucial there. And of course, funding. And we heard that quite often. Then we looked at the legal situation, and it was emphasized that in Germany, it is often the unclear status that is an issue here. While, there's a suspension on the ban, or like the ban of to send people back to Syria was lifted temporarily, and other issues. And many people in Germany are on temporary statuses, so their status is not settled. While in Turkey, access to work was identified as a main issue when it comes to the legal situation of Syrian refugees. And of course, all of that has a huge impact on mental health. So then we talked about COVID, and we kind of found out that it exacerbated a lot of the existing issues that were already affecting mental health of refugees, but it also created a couple of new ones, especially multiple new daily stressors because of the COVID situation. Not being able to visit relatives, and limited contact, loneliness, basically, all that. And then in the last breakout session, we talked about the question whether there is one unified community of Syrians, and kind of learned that the Syrian communities are very, very much reflecting the melting pot that Syria was and is to a certain regard, and that there are several communities existing. And then, we just talked about the obstacles and meaningful connectors here in the last panel. And we talked about the importance of family links. We talked about generational issues, about locational issues, differences between smaller cities, rural areas, and metropolitan areas. Again, we talked about funding and the need of destigmatization, and of course, language-specific aspects. That's it from my side. I hope you took as much from this as I did, and I would like to thank you all for participating, for sharing stories, for connecting with each other, which is one of the goals of this event. And of course, thank you. And thank you also to the organizers and the technical staff. Have a good Saturday afternoon. Thank you.